begin with, we would like to present a video profile of Iika Bhaktiviata. Assalamualaikum, Dato Senat. Could you hear my voice clearly?
Good morning. Yeah, I can hear you.
Okay. Thank you for joining us virtually. My name is Yeni. Welcome to Iika Bhaktiviata Kediri. The Honorable Datuk Senat is already here. We are delighted to have you here, Datuk Senat. Sorry, could you hear my voice?
Yeah, I can hear you.
Okay.
Good
Thank
morning,
you.
everybody.
Thank you for responding. We are delightful to have you here, Datuk Senat. Please kindly wait.
Sure, thank you.
We are going to start this seminar in no time. And this is the video profile of Iika Bhaktiviata Kediri. Hope you enjoy. Iika Bhaktiviata has got 4 faculties. It is the first health institute in Indonesia. We have got 4 faculties. They are Faculty of Pharmacy, Faculty of Medicine, Faculty of Dentistry, and Faculty of Technology and Health Management. And this is the compilation of video profile of Iika Bhaktiviata. Continued by Thomasong Dental Supply Video as our sponsor. And this is the video of Thomasong Dental Supply. Hope you enjoy. As our sponsor. And after this, we would like to present a video of safety induction. We would like to apologize for keeping us waiting due to the technical problems. Of the video profile of IIK Bhaktiwiyata, we would like to present Thomas Song Dental Supply Video as our sponsor. And this is the video of Thomas Song Dental Supply as our sponsor. And we would like to greet and warmly welcome everyone to this annual event who join us virtually on Zoom and YouTube live streaming. We are presenting the video profile of IIK Bhaktiwiyata, Thomas Song Dental Supply video, and continued by video of safety induction. Please enjoy and have a great time ahead. Well, Thomas Song established in 1970. It is a reliable name for dental supplier in Indonesia. And we really appreciate the support for the sponsorship. This event is fully sponsored by Thomas Song Dental Supply, Surabaya. Thank you. May we have your cooperation, participants who join on Zoom, to mute the microphone on your device unless you are the speaker. Thank you. We are presenting Thomas Dental Supply video as our sponsor. And for those participants who cannot access via Zoom due to several cases, the committee are providing YouTube live streaming in IIKA Bhaktiwiyata channel. Well, we are presenting Thomasong video for our sponsor, and this is Thomasong at a glance. Thomasong established in 1970, it is a reliable name for dental supplier in Indonesia. It has a vision to be the leading and largest distributor in dental supplies in Indonesia market. It has three missions: to educate, market, and distribute dental unit, equipment, instrument, and supplies that are supported by reliable, quick, and satisfying after-sales service. To be a strong business entity that is trustworthy and professionally managed. And to add value to the stakeholder, they are customers, employees, and owner. Hope you enjoy this video. We really appreciate the support for the sponsorships. This event is fully sponsored by Thomasong Dental Supply Surabaya. Once more, we would like to inform you that this is video of Thomasong Dental Supply as our sponsor. Please enjoy and have a great time ahead. We do apologize for keeping us waiting due to the technical problems. For those participants who join us virtually, could you hear my voice? And this is the video of safety induction. Hope you enjoy and have a great time ahead.
Auditorium of the Institut Ilmu Kesehatan Baktiwiata Kediri.
Sebelum melakukan aktivitas sesuai peraturan yang berlaku, kami akan memberikan informasi mengenai keselamatan dan keadaan darurat yang berlaku di Auditorium Institut Ilmu Kesehatan Baktiwiata Kota Kediri.
Before starting the activity in accordance with safety regulation, we will provide safety information and emergency procedure that apply in the auditorium of the Institut Ilmu Kesehatan Baktiwiata Kediri.
Ini Anda sedang berada di gedung Auditorium Institut Ilmu Kesehatan Baktiwiata Kediri. Gedung ini dilengkapi dengan APAR atau alat pemadam api ringan. Alat pemadam api ringan terdapat di setiap titik dan tersebar di setiap lantai. Jika terjadi kebakaran, bawalah APAR ke tempat kebakaran.
Currently, you are in the auditorium building of the Institut Ilmu Kesehatan Baktiwiata Kediri. This building is equipped with APAR or fire extinguisher. There are fire extinguishers at every point and scattered on every floor. In case of fire, take the APAR to the fireplace.
Yang pertama, tarik kunci pengaman. Kedua, pegang bagian ujung selang. Ketiga, arahkan ujung selang ke sumber api. Dan yang terakhir, tekan tuas dan arahkan ujung selang ke sumber tangkal api dengan jarak 3 meter.
So this is the video of safety
First,
induction.
pull the safety pin. Second, hold the end of the hose. Third, point the end of the hose to the fire source. And the last, press the lever and point the end of the hose at the source of the fire with a distance of 3 meters.
Gedung Auditorium Institut Ilmu Kesehatan Baktiwiata Kediri dilengkapi dengan 2 pintu darurat yang terletak di sisi barat dan timur.
The auditorium building of the Institut Ilmu Kesehatan Baktiwiata Kediri is equipped with 2 emergency exits located on the west and the east sides.
Jalur evakuasi telah ditentukan dan ikuti petunjuk yang telah terpasang.
Evacuation road is a road used to get a safe place in an emergency. The evacuation road has been determined and follow the post instruction.
Assembly point atau tempat berkumpul terletak di sebelah timur gedung Adipatma.
The assembly point or carrying place is located to the east of the Adipatma building.
Musola dan kapel berada di lantai 2.
Toilets are available on every floor.
Jika terjadi kebakaran dan alarm berbunyi, diharapkan untuk tidak panik. Ikuti petunjuk evakuasi sebagai berikut ini. Yang pertama, segera bergerak ke arah pintu keluar. Ikuti jalur evakuasi menuju assembly point. Yang kedua, usahakan keluar secara bergantian dan teratur. Yang ketiga, jangan berlari dan membawa barang berlebihan. Yang keempat, serta jangan mengambil resiko. Kelima, jangan menggunakan sepatu berhak tinggi. Dan yang terakhir, dahulukan ibu hamil, lansia, dan rekan yang memiliki penyakit kronis.
If it happens fire and sounding alarms, please do not panic. Follow the evacuation instruction as follows. First, immediately move towards the exit. Follow the evacuation road to the assembly point. Second, try to go out alternately and regularly. Third, do not run and carry excessive items. Fourth, do not take risks. 5. Do not use high heels. And the last, give priority to pregnant women, the elderly, and friends who have chronic disease.
Apabila terjadi gempa bumi, diharap untuk tidak panik. Yang pertama, berlindunglah di bawah meja atau menuju tempat aman di dalam ruangan. Yang kedua, segeralah melalui pintu keluar dan ikuti jalur evakuasi menuju assembly point secara bergantian dan teratur sesuai dengan arahan petugas kami. Dan yang terakhir, setelah berkumpul di assembly point, ikuti petunjuk dari petugas kami dan cobalah memastikan keberadaan rekan Anda.
When it happens earthquake, please do not panic. First, take cover under the table or go to a safe place in the room. Second, immediately go through the exit and follow the evacuation route to the assembly point, alternately and regularly according to our office directions. Third, after gathering at the assembly point, follow the instruction from our officer and try to confirm the whereabouts of your colleagues.
Demikian informasi tentang keselamatan yang berlaku di gedung auditorium Institut Ilmu Kesehatan Baktiwiata Kediri. Selamat beraktivitas dan utamakan keselamatan.
This is the safety information that applies to the auditorium building of this Institut Ilmu Kesehatan Baktiwiata Kediri for the safe activity and priority safety.
We would like to welcome all guests of honor and participants to enter this auditorium. Please be seated, because we will start our seminar opening program in no time. Thank you. Second International Seminar of Technology and Health Management, Faculty of Technology and Health Management, IIK Baktiwiata Kediri. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of IIK Baktiwiata, Professor Muhammad Zainuddin, Her Excellency, the Dean of Faculty of Technology and Health Management IIK Baktiwiata, Ms. Tri Ana Mulyati. With all due respect, due regard for something considered important on another occasion, His Excellency, our Rector, Prof. Zain, could not be present today. We would like to welcome our respected speakers. Ms. Reni Nugraheni, Master of Health from Institut Ilmu Kesehatan Baktiwiata Kediri. The Honorable Dato' Dr. Pratapa Senan, Divisi Pillai from Mahsa University, Malaysia, and Mr. Feby Dwi Rahmadi, PhD from Griffith University, Australia, who have joined us virtually in this event. Distinguished guests and participants, ladies and gentlemen, good day and welcome to the Second International Seminar of Technology and Health Management, Second ISOTECHMA, organized by Faculty of Technology and Health Management, IIK Baktiwiata Kediri, under the theme, Health System Support to Prepare Post-Pandemic Era, today, March 11, 2023. We wish everyone in a good health. My name is Yeni Nurmala and I feel honored to be the MC today. Thank you very much for joining us. This agenda is held both on-site in Auditorium Adipadma Building, 6th floor, Baktiwiata, and virtually on Zoom and live streaming on YouTube IIK Baktiwiata channel. Ladies and gentlemen, before we proceed this event, we really appreciate the support from the sponsorships. This event is fully sponsored by Thomasong Dental Supply Surabaya and all the parties involved in this event. Thank you. Excellencies, ladies and gentlemen, before we proceed this event, we would like to present a welcoming dance performance entitled Gandrung Dance. Now please welcome the dancers. A huge round of applause.
Recording in progress.
The inspiration for this dance is taken from the word Gandrung, which is interpreted as the fascination of the people of Blambangan to Dewi Sri or rice goddess, who bring prosperity to the community.
Wis wayahe awak rekote salam penghormatan sulung yo wajan tarik suarane awak riko wajan salam penghormatan don ambil kamu undangan muga-muga awak riko selamat kabeh yo wajan. Selamat kabeh awak riko wadah.
Ladies and gentlemen, please give a huge round of applause. Preceded our agenda this morning, may we present you the Indonesian national anthem Indonesia Raya. We would like to request all of respected guests and participants here to stand up or be in a perfect posture. And please kindly listen to the hymn of IIKA Bhaktiwiyata afterwards. Ladies and gentlemen, excellencies, please be seated. Continuing our agenda today, may we invite the Chief Organizing Committee, Ms. Endah Ratnani, to come up on stage and deliver some reports. Ms. Endah, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. The Honorable Rector Institut Ilmu Kesehatan Bhaktiwiyata Kediri, Profesor Dr. Apoteker Muhammad Zainuddin, Her Excellency Dean of Faculty of Technology and Health Management, Ms. Triana Mulyati, MSc, the Honorable Speakers, Mr. Febi Dwi Rahmadi, SKM, MPH, PhD from Griffith University, Associate Professor Dato Dr. Pratapa Senan, PVC Pillai from Masa University, Malaysia, and Ms. Reni Nugraheni, SKM, MMMKes from Institut Ilmu Kesehatan Bhaktiwiyata Kediri, and our dearest guests and participants. First, I'd like to thank Allah Subhanahu wa Ta'ala for giving us His blessing so that we could hold this event. Because of His mercy, we're sitting in this opening event in good health. I'd also like to convey my gratitude towards our Rector of Institut Ilmu Kesehatan Bhaktiwiyata Kediri and Dean of Faculty of Technology and Health Management who support us in many ways. And thank you to all speakers, Mr. Febi Dwi Rahmadi, Dato Dr. Pratapa Senan, and Ms. Reni Nugraheni, who set your valuable time to convey your material. And thank you to our guests and participants for coming to this event. On this occasion, I will talk briefly about our event, Second International Seminar of Technology and Health Management, ISOTECMA. Second ISOTECMA is an annual event held by Faculty of Technology and Health Management, Institut Ilmu Kesehatan Bhaktiwiyata Kediri. Second ISOTECMA consists of 3 main events. First event is International Seminar themed Health Support System to Prepare Post-Pandemic Era, held on today, March 11, 2023. Second event is International Competition, consists of poster competition and short movie competition. And third event is Guest Lecture, themed Digital Health as Professional Competencies to Prepare Post-Pandemic Era, that will be held on April 12, 2023. International Seminar of Second ISOTECMA was attended by approximately 900 participants from Sudan, Australia, Ethiopia, Malaysia, Timor-Leste, South Africa, Indonesia, and Morocco. On behalf of the committee, we hope this event can go well and smoothly. We're humbly asking for your support so that this event can run as well as possible. That's all for me. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you, Ms. Endah, for delivering the reports. Coming up next is the welcoming remarks by the Dean of Faculty of Technology and Health Management, IIK Bhaktiwiyata, Ms. Triana Mulyati. We would like to invite Ms. Anna to come on stage and deliver the remarks. Her Excellency, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Salam sejahtera, Om Swastiastu, Namo Buddhaya, Salam Kebajikan, best wishes to all of us. The Honorable Rector of Institut Ilmu Kesehatan Bhaktiwiyata Kediri, Profesor Dr. Apoteker Muhammad Zainuddin, the Honorable Speaker, Mr. Febi Dwi Rahmadi, SKM, MPH, PhD from Griffith University, Malaysia, Australia, Associate Professor Dato Dr. Pratapa Senan PVC Pillai from Masa University Malaysia, and Miss Reni Nugrahini SKM MMMKes from Institut Ilmu Kesehatan Bakti Wiyata Kediri, and our dear guests and participants. First, I'd like to thank Allah Subhanahu wa Ta'ala for giving us of His blessing so that we could hold His event. Because of His mercy, we're sitting in this opening event in good health. On behalf of Institut Ilmu Kesehatan Bakti Wiyata, I would like to welcome all distinguished seminar participants, especially of our speaker, Mr. Febi, Dato Dr. Pratapa, and Miss Reni Nugrahini. I would also like to convey my gratitude toward Rector Institut Ilmu Kesehatan Bakti Wiyata Kediri, who have supported the second international seminar of technology and health technology management. Besides, I'm grateful to the committee, sponsor, and all participants who have organized this event. For future agenda, I'm hoping for collaboration between IIK Bakti Wiyata Kediri, Griffith University, and Masa University, especially in education, research, and social responsibility. That's all my remarks. Thank you for the attention of the guests and attendants in this seminar. Enjoy, and wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Her Excellency, for delivering the remarks and sending a clear message. Ladies and gentlemen, next agenda, please be silent and bow our heads for a moment to say a prayer. To those who are in charge, please lead the prayers.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, let us bow our head and hearts in prayer for a moment to Allah Subhanahu wa Ta'ala. Therefore, let me lead the prayer in Islamic way, and those who have other religion are allowed to adjust the prayer in its own faith. Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. Ashhadu an la ilaha illallah wa ashhadu anna Muhammadar Rasulullah. Ya Rahman, Ya Rahim. Today, Saturday, 11th of March 2023, we are holding event the second international seminar of technology and health management ISOTECHMA with the theme Health System Support to Prepare Post-Pandemic Era. Faculty of Technology and Health Management, Institut Ilmu Kesehatan Bakti Wiyata Kediri. Ya Malik, Ya Quddus, we glorify your name because you alone are our Lord. To you alone we prostrate, and to you alone we give thanks. To you alone we pray. Ya Allah, Ya Ghafur, we worship and ask for help from you only. Ya Rabbana, open our minds, flex our tongues, and give us bright ideas to build the strength of this nation. O Allah, who knows the unseen, guide us with your guidance, place us always with your destiny, and make our heart always happy with your gifts. Rabbi israh li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, continuing our agenda today, we are going to take pictures to memorize this precious occasion. May we request our guests of honors and all participants to turn on the camera who join us virtually. Please turn on the camera, and then please position yourself in front of the camera and give your best smile. Our team will manage and start taking pictures. Let me lead. Okay, we have got 15 screens here. screen 1. Go on screen 2. Please position yourself and give your best smile. Screen 3, 4, 5. Okay, we have got 15 screens here. Please kindly wait. Our team will manage and take your pictures in turn. Well, thank you. It seems that our team already took your picture. And for participants who are on site in auditorium, we would like to invite all the committees, the dean, and the lecturers to come up on stage. We are going to take pictures to memorize this precious occasion. Baik, pada Bapak Ibu dosen, Bapak Ibu yang sudah hadir di sini boleh naik ke atas panggung untuk foto bersama. Our team will manage, and please kindly wait. Tes. Maybe we invite Mr. Datuk Senan to open the camera so we can take your picture. And of course, for participants who are from Morocco, Ethiopia, Sudan, South Africa, Australia, Malaysia, and Timor-Leste. So we can gather photo session together. Mr. Datuk Senan, Mr. Datuk Senan, could you please turn on your camera? Okay, thank you. Mr. Febi? Oh, okay. Mr. Febi hasn't arrived or joined yet. Okay, thank you, Mr. Senan. Please, okay, our team will manage it. Excuse me, Datuk Senan, could you please turn on? Okay, thank you. Our team will take picture. Please kindly wait for a while. Okay, thank you. We do apologize. It seems that we need to take pictures more. We need to take more pictures to memorize this event with all of the participants who are joined on site here. Okay, excuse me. We would like to apologize for keeping us waiting due to it seems that we need to take more pictures to memorize this precious occasion. Thank you. Continuing our agenda. Okay. Ladies and gentlemen, in a few moments, we are going to move forward to the main agenda, which is the seminar today will be moderated by Ms. Gerardine Ranin Kirana. Allow me to read the CV of Ms. Gerardine. Well, her name is Ms. Gerardine Ranin Kirana. She was born in Surabaya, East Java, Indonesia, 33 years ago. She obtained her master's degree on public health for Health Service Policy and Management, Gadjah Mada University. Currently, she is now a lecturer in Bachelor of Public Health for Health Policy Administration. She has conducted many research and publications and been presenters on national and international seminars. May we invite Ms. Gerardine to serve us the upcoming session. Ms. Gerardine, time is yours.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Allow me to introduce myself. My name is Gerardine Ranin Kirana. You can call me Gerardine or just G. I am a lecturer at Public Health, and it's an honor for me to be the moderator of today's seminar under the theme Health System Support to Prepare Post-Pandemic Era. Ladies and gentlemen, we're gonna have 3 speakers and 3 presentations today. The first one will be Ms. Reni Nugraheni, SKM MMKes from IIK Bhaktiwiyata Kediri, and the second one will be Mr. Febi Dwi Rahmadi, SKM MPH PhD from Griffith University, Brisbane, Australia, and the third one is Dato Dr. Pratapa Senan Pillai, PVC Pillai, from Masa University, Malaysia. Before we begin the presentation, allow me to inform you how the presentation will be presented. First, the speakers gonna be present their material, and then we're gonna have answer and question session. From the participant in auditorium, you can raise your hand to asking the question. And from the Zoom meeting, the participant can ask the question by sending the question on the link provided on the Zoom link, the Zoom chat box, I'm sorry. All right. Without further ado, I'd like to welcome our first speakers to the stage. Please welcome Ms. Reni Nugraheni. All right. Is it okay if we sit? All right. Is it okay? Okay. How are you? Thank you. Please sit, Ms. Reni. All right. Good morning, Ms. Reni. How are you? I'm fine. How about you? Oh, thank you for asking. I'm fine. Great, great. It's a good today, right? It's a great today to be here with the lovely Miss Reni Nugraheni, right? Okay, Miss Reni Nugraheni, allow me to read the CV from Miss Reni Nugraheni. Ms. Reni Nugraheni, SKM MMKes from IIK Bhaktiwiyata Kediri, Indonesia, will deliver her material under the title "The Pandemic Become a Momentum for the Transformation of Indonesian Health System." Ms. Reni Nugraheni was born on March 31st, 1989. She is now live at Gurah Kediri. Currently, she is a lecturer at Public Health Major for Health Policy Administration IIK Bhaktiwiyata Kediri and the Vice of Director Wahyu Husada Klinik Kediri. For the educational background, she graduated from Bachelor of Public Health, Institut Ilmu Kesehatan Bhaktiwiyata Kediri, Master of Management, Universitas Islam Kediri, Master of Public Health, Universitas Diponegoro Semarang, and presently she is a doctoral candidate for the Doctor of Public Health, Universitas 11 Maret Surakarta. She has 3 journals that has been published at Scopus under the title Relationship Between COVID-19 Risk Category and Community Knowledge about COVID-19 Transmission Levels with Preventive Behavior of COVID-19 Transmission on 2021. And the second one is the Social Capital Effect on HIV/AIDS Preventive Efforts, a meta-analysis on 2022. And the third one is identifying the factors affecting preventive behavior against COVID-19 transmission in East Java, Indonesia on 2023. All right, that's it for the CV because that's so long and many qualification from her. So is it okay if we end this? Oh, okay. Ms. Reni Nugraheni, I think the time is yours. So please.
Okay, thank you, Ms. Gerardine. Tes? Oh yeah, okay. I'm sorry with my tab. Maybe it's so funny, yes. With unicorn. This is my kids. Have my kids. Okay. Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of Institut Ilmu Kesehatan Bhaktiwiyata Kediri, Professor Dr. EPT Muhammad Zainuddin, whom we respect, Dr. Pratapa Senan, PVC, Pillai, and Mr. Febi Dwi Rahmadi, SKM, MPH, PhD, dear Mrs. Dean of the Faculty of Health Technology and Management, Ms. Triana Mulyati, MSI, and all guests and participants whom I love. Okay, I remember 4 years ago in 2019, I was in the same place at the same moment become a speaker, but at the time it was a national seminar. I would like to say thank you so much for this job event. This is more for me. Because today I have big opportunity with a wonderful topic in international seminar with academicians and practitioners. Hopefully it will be useful for us. Before I begin my presentation, let me introduce myself. I'm Reni Nugraheni. I'm lecturer of public health in Institut Ilmu Kesehatan Bhaktiwiyata Kediri. In special occasion, I'm going to present about the pandemic become a momentum for transformation of the Indonesian health system. Okay, my topics. Okay, yes, this is my topic. The pandemic become a momentum for the transformation of the Indonesian health system. Next. Well, currently we are experiencing a triple burden. The first, non-communicable disease, and the second, infectious disease, and the last, emerging and re-emerging disease. The non-communicable disease are still high and costed in Indonesia, such as blood pressure, stroke, heart disease, cancer, and others. And infectious disease, we know that tuberculosis, leprosy, HIV are still high in Indonesia. And then emerging and re-emerging diseases such as COVID-19, which we have just faced for the last 3 years. Okay, next. And we will briefly flashback what is Indonesia's strategy in handling the COVID-19 pandemic. Namely, with the strategy of breaking the chains of the spread of the virus with several attempts. Okay, we remember it. We call it the 4 T's: testing, tracing, tracking, and treatment. Then health protocol effort, and after a vaccine have been found, Indonesia is carrying out vaccination effort with the priority groups distribution stage until all people are vaccinated and COVID-19 can be under control in 2012. The latest data is January 2023. 74.48% of Indonesia populations has received a vaccine booster. Next. Okay, well, in the COVID-19 pandemic, it has provided valuable lesson for the government and also the community in controlling a disease. This gives color and creates a health transformation in Indonesia. Okay, next. Yes, even though the biggest problem in disease management in the last 3 years with COVID-19, Indonesia still has persistent health problem. Based on data, maternal and child mortality rate are still high, yes, we know it. And plus Indonesia is the second highest tuberculosis case in the world. 73% of deaths from communicable disease, which is higher than the Southeast Asian average of 60%. 39% of the population aged 15 years and over have a habit of smoking, the highest prevalence among ASEAN countries. Okay, next. Okay, I want to draw your attention to this point. The Indonesian Ministry of Health is committed to transformation its health system. The effort of the 6 pillars of transformation to support Indonesian health. The first, transformation of primary services. The transformation performed with improved population education, primary prevention, secondary prevention, and increase the capacity and capability of primary services. And the second, transformation of referral services. This is with improving access and quality of secondary and tertiary services. And the third, transformation of the health resilience system, with increase the resilience of pharmaceutical and medical device sector and strengthen the resilience of emergency response. And the fourth, transformation of the health financing system, with the regulation of health financing with three objectives, with available, sufficient, and sustainable, and then fair allocation, and effective and efficient utilization. And the fifth, transformation of human resources, additional quota for domestic and foreign scholarship students is the equalizing of foreign graduate health workers. And the last, six, health technology transformation, with development and utilization of technology, digitalization, and biotechnology in the health sector. Okay, next slide. Well, these are then the 6 pillars of health transformation in Indonesia that will be discussed together. Okay, next. Next. Okay. Yes, the first pillar is primary services. Preventable cause of death dominate the life cycle. Okay, we know. Meanwhile, health financing in Indonesia is only 17 for preventive and 67 for treatment. Case of disease that should be prevented and controlled are still high in Indonesia. As in case of neonatal disorder, sexually transmitted infection, example HIV, and lower respiratory infection, diarrhea, and tetanus. And also disease in children, adult, and elderly. Okay, it is our duty to support government program and effort to reduce and control disease. How we educated the community so they are able to maintain family health, so as to create optimal public health. Okay, next. Yes, we know public health center to Posyandu are the spearhead of health services with tiered types of services from Posyandu, assistant health centers, and tips to call it Puskesmas or public health center. Okay, next. Yes, in Puskesmas or public health center, effort to improve primary health services are carried out through 4 efforts. Remember it, 4 efforts. The first is education to the population with 7 main campaign: immunization, balanced nutrition, sport, anti-smoking, environmental sanitation and hygiene, disease screening, and medication adherence. And the second, primary prevention. Additional routine immunization from 11 to 14 antigens and expansion of coverage throughout Indonesia. Additional immunization like HPV for cervical cancer prevention, and then PCV for pneumonia, and rotavirus for diarrhea. And the secondary prevention, screening for the 14 highest cause of death for each age target. Screening for stunting and wasting, and improving ENT for maternal and infant health. And the last, increase the capacity and capability of primary services, strengthening primary services through building Puskesmas or public health center in 171 sub-districts in Papua and West Papua, and then meeting the needs of public health center and involving private clinic. Okay, let's turn to the next topic. Next. Okay, this is then the second pillar is referral services. Next. Yes, referral service health transformation focus on increased access and quality of secondary and tertiary services. The development of network of excellent services will focus on 9 catastrophic diseases. Disease with a high number of cases and deaths, such as stroke, heart disease, cancer, diabetes, kidney, liver, maternal and child health, tuberculosis, and infectious disease. And then program to increase access to hospital services. How, with contraction of primary hospital in disadvantaged area, border and outer area, in outer island. It is targeted that there will be an improvement in the availability of essential medicines in hospital for the treatment of 9 national priority diseases. And quality improvement through collaboration with global institutions and implementation of the academic health system. How, with partnership with World Stop Healthcare Center and university, example Mayo Clinic, MD Anderson Cancer Center, and Boston Children's Hospital. And then implementation of the academic health system for the implementation of health worker education and medical research. Okay, next. And then this is then The third pillar is health resistant. Okay, well, Indonesia, the pharmaceutical and medical device sector are also still significantly dependent on import. There are three problems that need attention in the Indonesian pharmaceutical sector. What is it? The first, 90% of medical raw material are still imported. And then 88% of medical devices are dominated by imported products. And this is because the research and development is still low. That is 0.2% in order to increase health resilience. Indonesia must increase independence in the pharmaceutical sector by being able to produce medicine raw material and supply medical devices from Indonesia companies themselves. By providing stimulus and support to pharmaceutical and medical scientists and supporting the development of pharmaceutical and medical companies in Indonesia. Okay, next. Yes, Indonesia needs to strengthen its ability to detect and respond to health crisis in the future in three aspects of vigilance. The first, health disaster preparedness, and then strengthening surveillance and health emergency system. Okay, next. And then this is fourth pillars is health financing. Next. Yes, Indonesia continues to make effort to improve public health and health services access. One of the programs to support this goal is the existence of health insurance, which is managed by a state agency and provides fair health services to all people. Health insurance, which is commonly called Health BPJS, to achieve universal health coverage. The decision to apply service rates to control the needs of the community and to affordability of health services is with Health BPJS to agree on rate for inpatient health services and determine capitation for outpatient care. The determination is also based on the result of a review of benefit on basic health needs with effort, improvement and addition of preventive promotive benefit that provide leverage in controlling catastrophic disease, and then control over a number of services that are excessive and have the potential for fraud. Imposition of cost sharing and cost difference in the national health insurance programs to increase community satisfaction in health services. Okay, the next, this is a fifth pillar is human resources for health. Human resources for health is key component to drive health development. Human resources for health play a role in increased awareness, willingness, and ability to live healthy for everyone in order to realize an optimal health degree. Health for the entire population in Indonesia. The transformation of health resources support the health system through effort to accelerate the availability, quality, and distribution of health workers. And well, IIK Bhaktiwiyata Kediri support the effort of the Ministry of Health in these 5 pillars. Yes, why? Because IIK Bhaktiwiyata Kediri produce professional health workers who are ready to support the government in improving public health effort. There are 22 study programs, I'm sorry if I mistake, and probably will continue to grow. And then the last pillar, okay, next. The 6th pillars is health technology. We are currently in the digitalization era, where the system runs faster and automatically. This is a positive thing that can support the health system in Indonesia. But in information system, we still have challenges, namely the existence of millions of data and hundreds of applications. Technology transformation and digitalization of health as a leapfrog toward advanced and equitable Indonesia health system, with several efforts, namely integration and development of health data system. We hope in 2024 there will be an expansion of the scope of the health big data system. Why? Because this data is basis for making decisions and policies. And then integration and development of health application system. And then development of the health technology ecosystem. We must manage it well. Okay, from my presentation above, let me sum up 6 points for health transformation. There is 6 pillars. The first is transformation of primary services, referral services, the health resilience system, the health financing system, health human resources, and health technology transformation. That's all my presentation. I'm sorry for having mistake in my presentation, and thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Ms. Reni. Maybe you can sit first here with me. All right, let's get to the next session, which is question and answer session. Just like I said before, for the participant in auditorium, you can raise your hand to asking the question. And for the participant on Zoom meeting, you can send your question by clicking the question link that will be provided in the Zoom chat box. Is there any question from the audience in this room? No one? Let me ask. Okay. Please come up to the stage.
Assalamualaikum warahmatullahi wabarakatuh. First of all, good afternoon, Ms. Reni Nugraini, Dr. Pratapa Senan, and Mr. Febi Dwi Rahmadi. My name is Nyoman Aryaguna Pramana Kamajaya from Hospital Administration, student of IK Bhaktiwiyata. I want to ask to Ms. Reni about why are 90% of the raw materials from medicine still imported, and aren't they also many of our pharmacies in Indonesian? Thank you.
All right. The first question from the audience. Let me ask the committee, is there any question in the Zoom chat box?
Yes, one question on Zoom. Should I read the question?
Yes, please.
Yes. This is the question from Patrick Berlian Yulianto from Public Health Students. So he is asking to Ms. Reni, we know that degenerative diseases are still high in Indonesia. You said earlier that one of the efforts is to increase public education. The question is, how to conduct effective education to overcome this health problem?
Thank you, Ms. Yani. That's the question for our first speaker, Ms. Reni. Are you ready to answer them?
Okay, thank you, Ms. Gerardine, and thanks for the participant. Yes, Mr. Komang. Yes.
Nyoman.
Oh, Nyoman. Okay.
Yes, Nyoman. The question from Nyoman and Patrick. Yeah, Patrick.
Yes, Patrick. Okay. Thank you. Okay. Technically, we know that there are many medicine companies in Indonesia, but material are still imported. Why? Because Indonesian market still just 0.4% of the world medicine market share. So this is not effective for medicine companies in Indonesia. Currently, so government must support the medicine companies with two, maybe number one, simplify to licensing, and the second is support medicine research. It's like that. Maybe.
That's for the first question.
Yes.
Okay, let's answer the second question from Patrick.
Okay, and then about education health. What's effective education health? It's so difficult, yes, because we know there are so many there's so many method, yes, method health education is like this demonstration, stimulation, and counseling. And what's the effective? It's all effective. We must know what's the target, how characteristic of the public, and what's our topic that I will educate to public. It's like that. Thank you.
Thank you. We still have some spare time. Let me switch to Indonesian. Teman-teman, paham tadi pertanyaannya tentang apa, jawabannya apa? Perlu kami ulang dalam bahasa Indonesia pertanyaan dan jawabannya? Boleh ya? Baik, silakan Bu Reni.
Okay, maybe it's better ya. Saya mungkin semua berpikir ini ngomong apa gitu ya. Saya dari tadi kayak nggak bisa nafas saya gitu, belepotan gitu. Nah, akhirnya ya bisa bahasa Indonesia. Baik, saya ingin menjelaskan tadi pertanyaannya ada dua ya tentang kenapa sih kok apa itu namanya bahan obat itu masih impor ya, itu yang menyebabkan harga obat menjadi tinggi. Jadi bahan bakunya. Kemudian yang kedua adalah tadi tentang promosi kesehatan apa yang efektif untuk masyarakat. Kita tahu bahwa ternyata masih banyak upaya untuk peningkatan edukasi kepada masyarakat. Lalu tapi kok masih banyak yang lifestyle-nya kurang bagus kan seperti itu. Oke, yang pertama tadi tentang ini ya, kenapa kok impor banyak yang impor. Jadi based on data ya, jadi berdasarkan data itu penjualan bahan baku Indonesia itu hanya 0,4% di sektor dunia. Jadi marketnya itu hanya 0,4%. Dan ini kurang efektif kalau hanya dibeli oleh Indonesia sendiri. Kenapa? Karena untuk menciptakan bahan baku obat itu tidak seperti membuat kue ya. Ada proses yang itu dananya sangat tinggi, terutama dalam menemukan ramuannya. Itu kan perlu penelitian ya, dan tahapan-tahapan itu dananya cukup besar. Belum lagi nanti perizinan, proses perizinan dan lain sebagainya. Dan jika nanti marketnya itu tidak sebanyak dibandingkan dengan modal yang dikeluarkan, itu kan kurang efektif. Sehingga mungkin ini yang harus dipikirkan oleh pemerintah Indonesia dengan jadi saran saya itu ada dua yang kami rekomendasikan. Yang pertama mensupport mempermudah perizinan, dan yang kedua mensupport penelitian tentang farmasi di Indonesia, sehingga pabrik-pabrik ya atau perusahaan obat di Indonesia itu bisa tidak perlu impor. Jadi kita menggunakan bahan baku obat dari Indonesia sendiri. Otomatis kalau bahan baku itu kita produksi sendiri itu akan jauh lebih murah gitu, dan itu sangat membantu untuk makroekonomi kesehatan tentunya. Dan kemudian yang kedua terkait promosi kesehatan yang efektif. Nah, ini ahlinya adalah para dosen promosi kesehatan ya di public health ya. Ini mana yang efektif, karena kita perlu sama seperti Bu Reni kalau mengajar gitu ya. Kadangkala saya harus kadang tuh kita kenapa sih post test pre test ya, untuk mengetahui kapasitas yang akan kita educate gitu. Jadi karakteristik yang akan kita berikan edukasi itu akan berbeda-beda, dan kita juga harus menggali dulu masalah kesehatan di sana itu apa. Karena dari masalah kesehatan, problem-problem yang ada di lapangan, nah kita bisa masuk di dalam celah-celah itu. Jadi kalau sudah misalkan mereka sudah tahu tapi ada problem lain yang menyebabkan perilakunya tidak berubah, nah kan percuma diedukasi. Jadi kita harus membantu mengatasi solusi di dalam masyarakat. Jadi memberikan edukasi yang efektif adalah sesuai dengan apa yang dibutuhkan dan mengenal karakteristik masyarakat yang akan kita edukasi. Nah, sehingga ini penting juga, ini saran saya kepada pemerintah ya. Kalau ini live YouTube dan mungkin dilihat ya oleh pemerintah, itu pentingnya kolaborasi antara pemerintah dengan akademisi. Sehingga instansi pemerintahan dan akademisi ini berkolaborasi untuk melakukan edukasi kepada masyarakat. Gitu. Terima kasih.
Okay, is there any other question from the audience? No one? Okay, I think that's it for the first presentation. Thank you so much, Ms. Reni. Okay, such a good discussion for the first presentation anyway. You can take your time after this to get a cup of coffee. Once again, thank you for sharing with us. And now for the next session, I'm gonna give it back to Ms. Yeni.
Okay, thank you.
Well, thank you, Ms. Reni. Ladies and gentlemen, you may please give round of applause to Ms. Reni and Ms. Geraldine. Ms. Reni, please just stand by. Please just stand. Okay, as a form of appreciation, Her Excellency, the Dean of Faculty of Technology and Health Management, Ms. Triana Mulyati, would like to give you a certificate as the speaker today. Ms. Anna, please come up on the stage. And our team will take picture to memorize this event. Okay, thank you, Ms. Reni. Ladies and gentlemen, before we proceed this event, I would like to greet Mr. Febi as our second speaker. Now with us, he is joining us on Zoom virtually. Good morning, Mr. Febi. Could you hear my voice? Oh, okay, that's okay. Okay, welcome to this event, Mr. Febi. So, we would like to inform you that Ms. Reni, our first speaker, delivered the topic just now, and we still have two more presenters here, including Dr. Dato Senan from Mahsa University, and you, Mr. Febi, please kindly wait, because after this, we are going to have a break for a while, for a few minutes.
Okay. Can you hear me okay?
Okay, sorry, I cannot
Can you hear me? Can you hear my voice?
Oh, yeah, okay.
Okay.
Yes.
Okay, just check.
Thank you, yeah. Please, I would like to inform that we are going to have a break for a few minutes. Please stand by, enjoying these two songs, and the coffee break outside after the performance of the two songs from our choir. Oh, yeah, of course. Yeah, okay. Respected speakers, may you have a coffee break on your own. Okay. And we are going to continue this agenda about 15 minutes afterwards. Okay, please enjoy the songs.
Semua kata rindumu semakin berdaya menahan rasa ingin jumpa. Percayalah padaku, aku pun rindu kamu. Aku akan pulang melepas semua kerinduan yang terpendam. Jangan katakan cinta menambah beban rasa. Sudah simpan saja sedihmu itu. Ku akan datang. Tak berdaya ingin jumpa. Percayalah padaku, aku akan pulang, aku akan pulang. Yang terpendam, tak berdaya menahan rasa ingin jumpa. Percayalah padaku, ku akan pulang melepas semua kerinduan yang terpendam.
Okay, ladies and gentlemen, please give huge round of applause for this beautiful voice from our choir. Thank you. Continuing our agenda today, I will return the floor to the moderator, Ms. Gerardine, to facilitate the second sharing and discussion. Ms. Gerardine, time is yours.
Thank you, Ms. Yani. Ladies and gentlemen, we're gonna begin the second presentation from Mr. Febi Dwi Ramadi, SKMM PhD from Griffith University, Brisbane, Australia. Mr. Febi will be deliver his material under the title Health System Strengthening in a Post-COVID Era. Mr. Febi Dwi Ramadi, PhD, is the course convener of Disaster Management and Resilient Building, Global Health Priorities and Interventions, and Health Program Planning, Monitoring and Evaluation at Griffith School of Medicine. He has worked for many years as Disaster Risk Reduction Manager for the International Federation for Red Cross and Red Crescent Indonesian Delegation Office. His PhD research was collaborative governance model to link between climate change adaptation and disaster risk reduction to build urban community resilience. He also holds position as the program coordinator for Indonesia, Center of Environment and Population Health, and the coordinator of the Risk Communication, Emergency Management and Adapting Climate Change for Health, REACCH Consortium. For the educational background, he graduated from PhD School of Environment, Griffith University, Australia, Master of Science in Public Health, Griffith University, Australia, and Bachelor of Public Health, University of Indonesia. He has many projects, such as at 2022, he is a co-leader of DFAT, Australia Award Indonesian funded short course on mainstreaming disaster risk management into annual national and subnational planning and budgeting. He is an associate investigator, Medical Research Future Fund, early to mid-career researcher grant opportunity with the research aim to develop an evidence-informed, community, consumer, and patient-level data-driven framework for ED disaster planning by understanding the impact of disaster on ambulance, ED, and hospital patient characteristics, outcomes, and health economics in the vicinity of a disaster. He is also a co-lead project and research funding from the Queensland Resilience and Risk Reduction Fund under the theme Fostering Culturally Inclusive and Future Prepared Emergency Management. On 2022, he has 3 journals that has been published under the title Indonesia Climate Related Disaster and Health Adaptation Policy in the Build-Up to COP26 and Beyond. And the second one is the effect of resilience on the relationship between perceived stress and change in alcohol consumption during the COVID-19 pandemics in Queensland, Australia. And the third one is factors associated with COVID-19 vaccination acceptance among Muslim high school students in Jakarta metropolitan area, Indonesia. For the professional experiences, currently he is a lecturer in Global Health School of Medicine, Brisbane, Australia from August 2016 until recently. And he is an Indonesian Program Coordinator, Center for Environment and Population Health from 2015 until now. Mr. Feby, are you here with us? The committee, please help Mr. Feby to unmute his mic, please.
Okay, so I just cannot unmute myself. Can you hear me okay?
Yes.
Okay, there's a bit of feedback there, so hopefully you can hear me okay. All right. Would you like me to start now or?
Yes, please. The screen is yours.
Okay. All right. Okay. Thank you so much. Please allow me to share my screen. Hopefully you don't have any problem. Okay. All right. Can you see my screen? Yes. Okay. So I'm assuming you can see my screen. Let me know if there's any problems. I'm currently in a hospital, so if there's any internet interruptions or background noise, so please forgive me. But just in case if there's any internet connections, please help me to please let me know so that I can try my best to fix the connection. Assalamualaikum warahmatullahi wabarakatuh. A very good morning to all of us. I would like to, of course, acknowledge, some key important people who attend in this session as well, which is Professor Dr. Apoteker Muhammad Zainuddin, who is Director 2 of Bakti Wiyata Kediri, and also Ibu Triana Mulyati, who is the Dean of Faculty of Technology and Health Management. First of all, I'd like to say thank you so much for inviting me, for having me in this very important conference. There has been lots of discussions about what should we do differently in post-COVID era. And I think it is important for us to have a discussions and learn from the previous history and how can we then project our future. And ability to learn from the past is one of the key important element of ability to project future. And so, all right. So let me just go to the first part of my presentation. I understand I only have about 40 minutes for me to present the whole presentations. Please let me know if time is almost up. So let me know so then I can try my best to complete all my presentations. There will be 4 parts in my presentation. The first one is it is important for us to understand the building blocks of health system, which I believe I came to the first presenter as well, but I was not from the beginning. So, but I believe the first presenter also talked about this as well. But just to make sure that all of us understand what are the building blocks of health system, because we are talking about how can we design our future health system, and it is important for us what is the ingredients, to build the health system itself. So the health system, it means, that it consists all of the organizations, institutions, resources, and people whose primary purpose is to improve health. So that is health system. So it's very complex. So health system is you're not only talking about healthcare, you're not only talking about medicines. Okay, so this includes efforts to influence determinants of health as well, which I believe you understand. Health, determinants are quite complex, as well as more direct health improvement activities as well. So the health system delivers preventive, promotive, curative, and rehabilitation interventions. So looking at the whole spectrum of health. Okay, so from preventive, promotive, curative, and rehabilitative. So there are 6 building blocks. Yeah, so we have service delivery, we have health workforce, we have health information systems, we have access to essential medicines, we have financings, and last but not least, we also have leadership. So if looking at service delivery, so this is about number of distributions of health facilities, number and distributions of inpatient beds. So looking at very technical things, including also general service, health facilities, offering special services, and etc. So we also have health workforce, which is very important, and I think your institution is contributing to the improvement of our health workforce in Indonesia, because you produce people who will be working within health sector. So we are looking at health workers, looking at distributions of health workers by occupations, because different type of professionals within the health worker, right? So we need medical doctor, dentists, nurses, public health professionals, pharmacists, and etc. So all these are very important, right? And I think it is also quite important for us to make sure we also have this financing system. So financing system is very crucial. Without finance, I understand many people mention money is not everything, but everything is nothing without money, right? So I think the previous presenter mentioned about importing importations of materials to produce drugs, for instance. So that is also something related to finance support as well. And last but not least, which is very complex, which is leadership. Okay, today is 2023, next year is 2024. It is election year, so Indonesia is quite hot at the moment because of leadership, the elections. Yeah, so and leadership has been very important, and I think in some of my content I'll be talking about the importance of leadership. And when we mention about future-proof health system, or what do we need to be done differently in the future, so leadership is something that needs to be discussed as well. Okay, all right. And when we talk about health system, it is also important for us to understand the governance as well. So the governance means the in Indonesian terminology means tata kelola, right? And in terms of tata kelola or governance, there are three important elements that need to be involved, which is the state, the citizen, all of us are the citizens, and the health service providers. Because the state means the government organizations, the ministries, the agencies at the central, at the subnational level. So all of these need to be involved. And when we talk about health service providers, not only public providers, but also private need to be involved as well. Okay, even not-for-profit clinical need to be involved, because we do have, in Indonesian context, we have non-governmental organizations, philanthropy organizations that also provide healthcare service. So these organizations need to be involved in the process as well. And last but not least is the citizen, I guess the populations, patients, even like the poor families need to be involved in the process as well, in the context of what health system that need to be, what do we need to improve in terms of future health system. So all these elements, all these actors need to be involved if you want to be successful. Okay. So that was the first one. And the second one is what have we learned, okay, from previous history. Okay. So it is important for us to be able to look at the back, for us to be able to move forward. Okay. So many people mention don't look at your back, but I'm kind of a person that for you to be able to go forward successfully, to understand your history and to understand what have you done before, right? And in the context of disaster risks reductions or disaster risks management, ability to learn from previous disaster is one of the key foundations for you to be able to do preparedness. So when you look at this history, we are located in Asia Pacific region. And according to the history, Asia Pacific is 3 times more vulnerable to be impacted by disasters, including pandemic, compared to other regions. Okay, and unfortunately, we are located in Asia Pacific, Indonesia. So we have a different type of outbreaks, disasters, which might lead to public health emergencies. Okay, so we have emerging infectious disease. So this is just, I took this from Prof. Chandra's presentations, and this is from 2009 up to 2021, and today is 2023, but this is very recent still. And if you look at this one here, we have avian influenza, we have Ebola, we have Middle East respiratory syndromes or MERS, we have dengue, Zika virus, okay? And not to mention, we also have cyclones, floods, droughts, earthquakes, tsunamis, volcanoes, everything together. And last but not least, also important to mention about the antimicrobial resistance, AMR, which is also add to our regional vulnerability. So unfortunately, COVID is not the only one. So when we mention about post-COVID era, we are actually in the stage where we are going to enter the next one. Okay, so we have to put it that way. Instead of mention that we have, this is already passed, or COVID already passed, what else? MERS already passed, or Ebola is a pass. Okay, so it is better for us to say to ourselves that we are actually in the middle of, we are preparing ourselves to be challenged by another pandemic or another disaster in the future. So that way we are in the position of preparing ourselves and getting ready to be impacted by another disaster or pandemic. Okay, so if you look at this one here, it's important for us to learn what are the risk factors. Yeah, so when you talk about COVID is a lot of research mentioned it used to be a zoonotic disease, or it is actually coming from animals to human, and then human to human, right? So become pandemic. So if you look at this one here, number 1 till number 13, so these are the risk factors of EID, okay, or emerging infectious disease. So if you look at this one here, the first one, microbial adaptations and change. So they are changing, the pathogens are changing because of climate variability. Okay, so human need to change as well because the viruses are changing. They are mutating, right? So, and the second one is we have human susceptibility to infections. We have climate and weather, and we have changing ecosystem, which is also related to human activities. We have economic development and land use, which is again about human activities, human demographic and behavior, okay, technology and industry, and etc. So if you look at this one here, even number 13, intent to harm. So intent to harm means by purpose. So people spread disease because of bioterrorism, for instance. They just intentionally they spread virus or they spread disease. So this is something that will happen or has happened in our world. Okay, so I'm trying to say that after COVID-19, there may be something else in the future. So that's why this kind of discussion is very important. What needs to be done differently? What needs to be prepared? What can we learn from history? And what are still the gaps? Because I believe, there are a lot of things that is still missing in our preparation. So that is why important, as your and I think your institution play a very important role as well in terms of fulfilling or narrowing the gap. Okay, so if you look at the articles that has been published, so COVID-19 exposes our protein system. So COVID-19 doesn't break the system, but it exposed the protein system. Okay, so you can see the differences, right? So between expose our protein system and breaking the system itself. Yeah. So if you look at this first one, so if you look, okay, so coronavirus exposes major flaws in healthcare system. So this is not only the context of America, but the whole world as well. COVID-19 has revealed America's broken healthcare system. What can we learn? Okay, so COVID-19 pandemic demonstrates the critical need to reimagine and repair the broken system of global health. So specifically, the pandemic demonstrates the hollowness of the global health rhetoric and equity. So if you know bamboo, like bamboo has a hollow inside, right? So hollowness of global health rhetoric and equity. So we've been talking about global health, we've been talking about regional security, but according to this article, it is actually there's a hollow inside that system, which is there, which means there are a lot of gaps within the system. Not only America, and not only about healthcare, but COVID-19 exposes the UK broken food system. And maybe this is also the case in Indonesia, and COVID-19 reveals weak health system by design, why we must remake global health in this historic moment. So this is about the global health system, which is, because pandemic is something that needs to be discussed globally because one disease, and this is also according to the article as well. If there is a new disease somewhere, in another country, for instance, within 3 days, that particular disease might reach to your backyard within only 3 or 5 days because of easy transport, right? So people now can fly. Even AirAsia, the motto of AirAsia. Disease is also a virus. I can hear my own voice. Can you hear me okay? Yes? You hear me okay, right? The recording was stopped. Was it done intentionally or accidentally? I cannot hear anybody. I'm a bit worried here. Can you still hear my voice?
Yes,
Okay, all right. It's like I'm talking with my own laptop, so because there is no feedback. Okay, all good. Okay, so then, and the last but not least, this is what I want to share as well. COVID-19 tragedy exposes how broken Indonesian politics is. So this is not only Indonesian, but basically in many countries. So they also expose different, systems. I mean, different sectors, including also the leadership and also the politics as well. Okay, and of course we need to appreciate, what have we done as well in terms of COVID-19. And I really appreciate, the ministries, the Indonesian government, which have done tremendously, in terms of saving our country from COVID-19. But something that we need to learn as well, that COVID-19 pandemic has had a significant impact on almost all sustainable development goals, so leaving no country unaffected. So we have 17 goals, which I think everyone aware already, in terms of sustainable development goals, and we only have about 7 more years to reach 2030. And all of these 17 goals are being affected or have been affected by COVID-19. Okay, so we are not too sure whether we can reach our goals in before 2030. However, it is important now in the the remaining years that we still have for us to be able to see what can we do in terms of boosting our efforts to fulfill our goals, SDG goals. So from the lesson learned, so we also there are 6 important elements or 6 important factors. The first one is understanding our own strengths and weakness, including healthcare preparedness. So this is important. So from the beginning, it's important for us to understand what is our strengths, what is our weakness. Okay, so before we do the program. And the second one is it has to be research or evidence-based policy development combined countermeasures. So it is important for us to use different type of strategies, and it has to be combined effectively. Testing, coverage, contact tracing, so all these are related to surveillance systems, effective public communication. So this is something related to community engagement. All right, so if you look at this one here, key success factors of winning the war with COVID-19, it is not only about technology, but it is also about the people. Okay, because to win the battle, we need to get support from our community, right? So you need to get support from your citizens. So effective public communication is very important. Community empowerment and law enforcement is very important. So law regulations is something that I would say, especially in Indonesia, so because we are a very big country, right? Compared to Australia, Indonesia is much bigger in terms of populations. So that's why, law enforcement is very important, which I think that is something still need to be improved in Indonesia, law enforcement, right? And last but not least, we have vaccination coverage. Okay, so that is also very important in terms of dealing with pandemic. Okay, so these are the 6 success factors. And I would like to also put more highlights on community engagement as well here. And this is from the publications by Nature Medicine, so which is one of the top publications in the world. So if you look at here, community engagement is the core as a core to all elements of health system resilience. So we've been talking about health system, and now we're talking about health system resilience. And so we have health system delivery, we have governance and financing, health workforce, medical products, public health functions, and the core of all of these elements is community engagement. Okay, and then the next layer is collaborations across sectors. Okay, collaboration is, I would say, it is almost impossible for a government to complete a program without collaborations across sectors. Okay, especially health sector, because health we know we have health in our policies, so health is not only about health sector. So when we want our people to be healthy, it is not only the responsibility of health workforce only, but it has to be the responsibility of the citizen as well. And the next layer is the health equity and outcomes. So, and this article is about talking about, lesson learned from 28 countries and looking at how they become resilient in dealing with pandemic. So health equity and outcomes are very important. So accessibility of vaccine, accessibility of medications, treatments, what else? Healthcare access. So all these are very, very fundamental. Yeah. So resilient health system should aim to generate positive physical and mental health outcomes for all, including vulnerable and marginalized groups. So we're not only talking about people, in general only, but we also have to talk about vulnerable people at risks, those who are marginalized, disabled people. So these populations need to be the key players as well in terms of health system resilience. Okay, so all right, now it is also important for us to have an integrated plan to end the pandemic. So although maybe we have mentioned it is already, of course, COVID-19, but I'm not too sure because last week I still can see my friend who just got COVID-19. So we still have people who are impacted by COVID-19 in 2023. So COVID-19 is still there. However, the situation is different, right? So the people are different. Now we are vaccinated, the system are different. So we need to be aware that the virus, the pathogen are still there. Okay, so it is important to look at this one here. So we have COVID-19 preparedness and response coordinations. And in the context of many countries, I understand Indonesia is still using ad hoc approach. Yeah, we still have team, team ad hoc team. So that's English. I'm trying to find the Indonesian word for that. Team ad hoc. I think we all use the same word as well. Anyway, so team ad hoc. So ad hoc means not permanent. Yeah, so not permanently exists in that system. So if you look at countries who have been successfully dealing with COVID-19, so they are away with. They don't use this kind of ad hoc system. So they actually build the system. Okay, so later on I'm going to talk to you about the Australian examples. So we don't use ad hoc mechanisms. We use the system that is already been established, and then we even try to improve the existing systems. Okay, so and it is also important for us not only to look at COVID, not in English, we call it overrated COVID. Okay, overrated, too much focus on COVID-19. Okay, don't put too much your attention to COVID-19 because there are a lot of other things that is even bigger than COVID-19. Okay, so, and the problem is the serious difficulties facing health system and other institutions in tackling the ongoing pandemic underscore the likelihood that things may also be ill equipped to protect and save lives under the stress of climate change. Okay, and I also need to remind you that these crises are occurring simultaneously, not one after another. Does not mean, so if you look at the picture, it does not mean after COVID we have recessions, after recession we have climate change, after climate change we have biodiversity collapse. So it does not mean like that. So, but they are actually happening at the same time. Okay, they happen at the same time. And if you look at the wave here, so it is actually, I like this kind of illustrations because it's like a tsunami. So we have recession is even bigger wave than COVID. Climate change is even bigger than recessions. biodiversity collapse is even bigger than climate change, which is actually also the outcome of climate change. So if you look at economic recessions might worsen health in low-income and middle-income countries with precarious job markets and weak social protection systems. And climate change, if we talk about climate change, I believe everyone understands about climate change or have heard about climate change. So has immediate and projected wide-ranging long impact on human health, including stressing food systems, economies, and communities, as well as pushing more people into poverty. Okay, so climate change, according to the latest report of IPCC, might potentially push back the development up to 50 years behind. So they might push Indonesia back to, I don't know, 50 years behind because of climate change. So that is quite scary, right? So, and we also have biodiversity loss. Okay, it can have significant direct human health impacts if ecosystem services are no longer adequate to meet social needs. Okay, so we need to be grateful that up until today, the world provide us with food, provide us with energy, provide us with oxygen. So all these are basically about the balanced system of the environment. But if we have this biodiversity collapse, it won't be able to support our, the human needs again. And that will be also, it means also the human collapse as well. All right. According to the World Economic Forum report, which is the global assessment report, and this is the latest one, which is published, I think, several weeks ago. So we have, this is the top 10 risks that might happen within the next 10 years. Okay, so today is 2023. So this is something that might happen in the next 10 years, okay, up until 2033. The first one is failure to mitigate climate change, and the second one is failure to climate change adaptations. Okay, if you look at that one, so that is the first and the second possible risks. So if you are an investor, okay, let's say if you are, if you have money, let's say for instance, and then you want to design your health system according to what will be the potential risks in the next 10 years. So you need to look at this, this report, right? So we need to see, so these are the 10 possible risks that might happen in the next 10 years. And this work looking at okay, so, and not to mention as well natural disaster and pandemic is also included in this aspect as well. All right, so it is important for us to understand how climate change might exacerbate the pandemic, might exacerbate human vulnerability. Right, so look at this one here. These are the health outcomes: injury, mortality, health-related illness, respiratory illness, etc. Okay, so climate change is the single biggest health threat facing humanity, and health professionals worldwide are already responding to the health harms caused by this unfolding crisis. All right, so it's very, very crucial for us to understand when we want to design our healthcare system, it is important for us to make sure that we also include climate change or climate crisis in the process as well. So if you look at this one here, this part, okay, the health system's capacity and resilience, so we have leadership and governance, so health workforce. So basically, these are the 6 building blocks of health system. And we need to make sure these 6 health system, they responding to the potential risk factors of climate change. So the third section that I'm going to ask everyone here, are we ready for tomorrow? Okay, so tomorrow if you have something to, let's say tomorrow we have wedding ceremony, for instance, and you need to, you know what you need to prepare. So tomorrow we are attending an exam, for instance. You need to know that you need to prepare something. The problem is we don't know when will the next pandemic will come. Is it going to be next year? Is it going to be next week? Is it going to be next month? We don't know. Okay, so it is important for us to get ready basically from now. Okay, so we need to prepare ourselves from now because there is an uncertainty there. So we know it will happen, but we don't know. Okay, so it is important for us to reimagine our future health system. So we need to know what kind of health system that we want to have or we want to be in the future. Okay. Okay, and then I'd like to share this one here. So this is something that is published before COVID-19. Okay. Late 2019, but before COVID-19. But WHO has already published this framework, which I believe maybe many of you have seen this framework and then you can also go to Google and you can download this for free. And it is about health emergency and disaster risks management framework. If you look at one of our publications, looking at how Indonesia might adopt this framework. So looking at from the Minister of Health, of course, and looking at the readiness of Indonesia to adopt this new framework. Okay, and I believe Indonesia is quite ready in terms of the policy. Okay, I'm not too sure about the human, but in terms of the policy, they are quite ready. So it is something that we need to look at as well, especially Indonesia is a big country, decentralized system as well. So maybe national, they have more awareness. I'm not too sure about the provincial level. So this is something that we need to evaluate. So if you look at this one here, there is a shift paradigm between event-based to risk-based. So we're looking at the risks. And later on after this, I'm going to share with you what ingredients, what does it mean by risks? Yeah, so because we are looking at risk-based. So that's why it is important when we want to design our future healthcare or future health system, we need to understand the risks as well. So from reactive to proactive, from single hazard to all hazards, single agency, and etc. So I think my time is almost up. So if you look at this one here, on the right-hand side, we have collapsing, recover but worse than before, recover to pre-event state, recover better than before, and the best one is transform. So if you look at from the healthcare sector or the health systems perspective. So again, if you look at this one here, risks involve exposure, vulnerability, the hazards. So if you look at here, transform, recover better, and recover to pre-event state. So if you want to design our future health system, so in which position you want to be? Okay, of course you want to be in the transform level. Okay, nobody want to collapse. Nobody want to be in this stage as well, recover but worse than before. So we need to ask ourselves, what is needed for us to be able to transform our health system? Okay, so because this is shock, this is COVID-19, if you look at this one here, and then if we are resilient, and then of course there must be some impact that is quite natural, but then we are able to bounce back to a stage where we are actually much better than before. So we have to be in this level today, transform. Okay, when you mention about new era or normalitas baru, whatever you want to say, we have to transform our health system. And then the question is how we transform our health system. Okay, so we need to use this opportunity. So post-COVID era is a good opportunity for us to do a lot of research to develop a robust and connected human health system. Okay, and not only human health system, but also including animal and environmental health. Because as I mentioned earlier, most of these emerging infectious diseases are related to animal health and environmental health. Okay, increasing capacity and capability in the public health workforce, strengthening leadership, up until developing national data system. Okay, and as we know, we are in the digital era now, so data is very important, and data has to be shared to public as well. So health system, and this is also published before the pandemic, but if you look at this one here, we always have PPRR approach, which is preparedness, response, recovery, rehabilitations, and health system. So we've been actually talking about this since before COVID-19. So, but the emergence of COVID-19 pandemic has brought with a sharp focus on public health service and health system. Okay, so I just attended, so this was I think 3 weeks ago, the inaugurations of YAPMI in Indonesian Public Health Associations. So I'm actually one of the committee member of YAPMI, and then we've been discussing about the role of Puskesmas. Okay, so we have revitalization of Puskesmas for the community health center. So community health center play very important roles. So they should play a very important role in terms of inter-pandemic phase. So preparedness, okay? So Puskesmas need to have this. So when we talk about the future design of health system in Indonesia, so they need to provide bigger role to Puskesmas. Of course, not only just bigger role, but bigger support, financial support, human support, the workforce support, so that they can do this, they can do this program, okay, One Health approach. Okay, not everyone understand about the One Health approach. The combination between human, animal, environmental, we often still working in silo approach. Human health, they do themselves. Animal, they do work themselves, and the environmental health people, they do work themselves. Okay, all right. So this is just an example of different countries. So they have. If you look at this one here, every country might have different needs. So we don't have Indonesia here, unfortunately, but this was published in 2021. So hopefully Indonesia, there will be more research in Indonesia in terms of climate smart interventions, COVID-19 response and recovery components, so how they actually work together. Right. So if you look at this one here, even when we talk about ecological approach of public health. So when we want to deal with things like COVID-19, we cannot, just thinking about how to save the human. This is what we call by human-centric approach. We also need to look at the animal. We need to look at the environmental approach as well. Okay, so in terms of healthcare preparedness, they actually go hand in hand with public health system. And if you can see, this is from the US CDC basically, and I think in Indonesia also follow this concept as well. So we have public health preparedness and healthcare preparedness capabilities. So when we say about COVID-19, post-COVID-19 era, so do we actually have these capabilities? So we need to evaluate ourselves within number 1 to number 5, like for instance, medical search. Number 10. Medical search is very important because medical search is the ability to provide adequate medical evaluation and care during events that exceed the limits of the normal medical infrastructure. So, such as we have a big disaster or big pandemic or the serious pandemic like we just had before. So medical search, how we can resource ourselves. Yeah. Okay. So I'm not going to talk into detail here because this is like a bit too much detail for you. Okay, key principles. So embrace a new risks language that cuts across multiple disciplines. So we need to, when we talk about pandemic, we need, especially if we want to invite people from different sectors, we cannot talk from medical language or health language only. So they need to understand the language, so then we can invite them. Okay, so step up participations, enhance multi-scale risks management. Okay, so Last but not least, I would like to share a little bit about the example of in Australia. In Australia, because we've been impacted by COVID-19 as well. And Australia is one country, so Indonesia, we don't have CDC, okay? So in Indonesia, I think Indonesia, we do have like CDC in Indonesia, yeah, but like Center for Disease Control, but Australia, learning from COVID-19, so they plan to have CDC, they plan to have Center for Disease Control. So this is something that is a big difference. So there will be a big difference in Australia. For those who don't know Australia, so this is how Australia looks like. So this is the continent of Australia. The continent. Australia is a country and also a continent as well. All right. So if you look at this one here, very nicely they put into a picture of the continent of Australia. So this is the public health landscape in the future. So this is what Australia wants to be. And I think Indonesia need to have something like this, like a roadmap, right? So the underpinning essentials. So if you look at this one here, workforce, Australian populations, which is the citizens, the legislations, the key policies, infrastructures, manufacturing and supply, funding, information technology. So IT is very important because this is digital era. We're talking about telehealth, we're talking about telemedicines, we're talking about the integrations of data collections, all right? Now, if you look at this one here in more detail, I think you can see from big screen in your venue there. So everything is there. So we're talking about, like, for instance, we have influencing factors, we have culture, okay? And we also have preventions, promotions, and protections, including immunizations, epidemiology, biosecurity. Like, if you go to Australia, so for those who haven't been to Australia, you cannot bring, I need to let you know that you cannot bring things like, meat, fruits, because they have a very protective biosecurity. So when you want to be nonsense we talk about future hospital, future healthcare, if we still allowing people bring disease from overseas. Does that make sense, right? So this is very important for us to have a very comprehensive mindset. So it has to be led by the government, of course. Last but not least, I would like to share with you is the design principles of our future health system. So the first one here, because this is related to Australia, so fit for purpose for a federated system. Indonesia is a republic, of course, so we need to make sure that the systems that we have is decentralization, so fit with decentralizations, and improve pandemic preparedness. So we need to improve all Australia considerably have a better pandemic preparedness compared to Indonesia, but they want to improve the pandemic preparedness still, because we still do have people die because of COVID-19. All hazard approach is very important. Right? So not only COVID-19 that we are dealing with, but we are actually dealing with multiple hazards. So in our concept, we need to include those aspects as well. Trusted, okay? Trust from the community is very important. Get support from the government, from the community is very important. Access to quality data for decision and policy making process. Okay, so that policy making has to be based on data. Avoid duplications, okay, and maximize efficiencies. And last but not least, successful co-design and consultations. So maybe your institutions, your academy can also play important role in terms of understanding the need of how in terms of Kediri, for instance, in East Java, so how we need to, what need to be prepared for us to prepare our future health system. So we need to get input from different stakeholders. Okay, so co-design and co-consultation is an important thing because this is the era of co. So everything has to be co, like collaborate, cooperations, co-design, yeah, and etc. So maybe that's all what I would like to share. So if you have anything you would like to ask or if you want to add anything, please do so. Everyone is still learning, including myself. So COVID-19 is new to everyone. So feel free to provide any comments or input. Thank you so much for your attentions. I would like to return the microphone to the moderator. Thank you.
Thank you. Thank you, Mr. Febi. All right, let's move along to the second question and answer session. The rules is still the same as before. Is there any question? Okay, let's come up to the stage, please.
Assalamualaikum warahmatullahi wabarakatuh. First of all, good afternoon to Mr. Febi Dwi Rahmadi, Miss Reni Nugrani, and Dr. Pratapasenan. Before, my name is Nadia Zahra Putri Hakim from Medical Laboratory Technology, student of IIK Bhaktiviata Kediri. I want to ask to Mr. Febi about how important this language contributing in a post-COVID-19. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. And from the room chat box, is there any questions?
Yes, excuse me. There is a question from Zoom. The question is from Jehian Apta Giovanni, a public health student from IIK Bhaktiviata. Thank you. And the question is, there are two questions here, Mr. Febi. The first one is how important is language contributing in a post-COVID? And the second one, how affect climate resilience in health facilities in a post-COVID?
Mr. Febi, are you ready to answer them? For once again, the screen is yours.
Okay. We need your help to unmute Mr. Febi.
I need you to unmute yourselves. I won't unmute myself again. Sorry, I didn't get the first questions. Can you please repeat the first one? Maybe moderator, can you please repeat the first question? So what is the questions?
The risk. Will you come up, please? Nanda, is there Nanda? Yeah. Nandia. The risk language for COVID-19 era. The risk language.
Not from Giovanni. Not from Jahian. I think there is also one question from the audience. I didn't get the questions.
Yes, Nadia, you can come up to the stage once again. If I'm not mistaken, you asked about the risk language. Still, the question the same as Jahian. Am I right?
All right. Okay, so the question is what does it mean by risk language? Is that right?
For the first question, you asked the risk question. The risk language.
Contribution in a post-COVID.
Yes, Mr. Febi. I think The question from Nandia, same as the question from Jaehyun, the first question from Jaehyun.
Makes my life easier. Thank you so much. Okay, so in terms of risks language, because when we want to change right of self, it is important for us to have risks perceptions. Yeah. So this is talking about the model of human change, human behavioral change. Yeah. So risks language is an important thing. It is important for us to understand what is the equation of risks. So we have exposure, we have vulnerability, right? So we do have also the hazard itself. So when we talk about COVID-19, we are actually talking about what does it mean? What is the COVID risks? We are not only talking about the virus, but we are talking about the impact of COVID-19. We are also talking about what contributing to the impact of COVID-19. So let's say we are talking about comorbidities. We are talking about the factors that might worsen the impact of COVID-19. So when we talk about risks language, so we are actually, let's say when we talk about post-COVID-19 era, okay, so, let's say COVID-19 is no longer there, okay, because we have vaccination. But because I didn't put this in my slide, but we do have what we call by the push and pull factors that might increase the risks, okay? So what factors that might increase COVID-19 distributions or COVID-19 infections? Let's say unsafe environment, let's say live market, let's say exotic animals, illegal, exportations of, the animals, the wildlife, yeah, people trying to, deforestations, illegal logging. So all these are contributing to COVID-19 risks. So it is important for us to look at from the comprehensive angles, not only from the COVID-19 itself. Yeah, so I have another presentation. We're actually talking about looking at COVID-19 from systemic risks, because COVID-19 is not only about the SARS-CoV-2 virus. Okay, COVID-19 is not just about vaccinations, but it is also about human behavior. It is also about the natural or environmental degradations, right? So all this need to be included in the discussions. So that is what I meant by risks language. So when we talk about how to avoid COVID-19 in the future, so we know that it is not only the virus, that we need to avoid, but we need to avoid all these aspects as well. Okay, we need to avoid all these factors that might contribute to COVID-19. Does that make sense? Jadi harus dilihat secara komprehensif, ya tidak hanya virusnya only, tapi juga dilihat secara komprehensif apa saja yang dapat meningkatkan risiko terjadinya pandemik lagi seperti halnya COVID-19. Jadi harus dilihat secara mendalam, dan ada yang namanya risiko sistemik, ya, systemic risks. Dan itu ada bukunya juga, ya, yang berbicara tentang kemampuan kita untuk melihat faktor risiko dari sebuah outbreaks, ya, potential outbreaks or re-emerging infectious disease. Jadi dilihat dari berbagai macam faktor yang akan membuat kita menjadi lebih komprehensif dalam membuat strategi to prevent. Okay, so that is what I meant by risks language. Okay, so hopefully that makes sense, ya. Lalu yang kedua, what was the second one? How effective climate resilient in health facilities in a post-COVID? Okay, so if I can get your question correctly, so you're talking about maybe the correlations between climate resilience and post-COVID-19. Is that correct? So I believe that is the case. So
recording in progress.
So if you in one of my slides, I mentioned, we have COVID-19, we have recessions, we have climate change, we have the biodiversity collapse. So climate resilience, so we do actually have, so if you go to WHO, so WHO has published climate resilient, climate smart, so they call it climate smart healthcare. Okay, so climate smart healthcare is, so one of my PhD students, so she just graduated last year from Taiwan, and her PhD thesis was about future-proof hospital. A very nice topic, future-proof hospital. So looking at how hospital at one stage contribute to the improvement of health of our citizen, but at the other hand, hospital also contribute to the destructions, to destroy our environment. So that's quite pity to hear as well, right? Because of the medical waste, because of the plastic pollutions that produced by hospital. So hospital need to be, they need to make sure, we need to make sure that hospital also become, concerned about environmental degradations, plastic waste, and etc. So climate resilience means we need to be able to, accountable to what we are doing. So the first principle is do no harm. Okay, so do no harm means when you do something, so you don't destroy our environment, because like now there are quite a number of movements like green hospital. We do also have climate smart hospital. We do have the climate and disaster prepared hospital. So there are a number of models that you can also look at from Google as well. And COVID-19 is just one small thing that we are actually dealing with. When you actually do climate smart hospital, when you do have climate and disaster prepared hospital, so COVID-19 will be also included in that aspect as well. Yeah, because it is all about, when you go back again to the presentation about the WHO publications, right? So ability to transform, when there is a shock, when there is a disaster happen, and then you need to be able to transform your hospital into something that can be even better than before. So we don't have to reinvent the wheel. Jadi tidak perlu membuat model yang baru. Yang penting adalah bagaimana kita bisa. I'm just trying to use, the Indonesian as well. So it is important. I think it's quite fundamental for us to understand. Adalah kita tidak perlu membuat model yang baru. Kita dengan model apa saja yang sudah ada kita kombinasikan, dan itu saya rasa dapat efektif ya untuk bisa menjadi sebuah model atau desain yang dapat membuat kita menjadi lebih resilient untuk menghadapi next pandemic. Mungkin itu. I'd like to return back to Ibu Moderator.
All right. I'm deeply sorry, Mr. Feby, because the time is running late. I think that's all for the second presentation. I would like to say thank you for once again to Mr. Feby for such an informative discussion today. Ms. Yani?
Well, thank you very much, Mr. Feby. May all of us get the value and benefits from the presentation. And as a form of appreciation, Her Excellency, the Dean of Faculty of Technology and Health Management, IIK Bhaktiwiyata, Ms. Triana Mulyati, would like to give you a certificate as the presenter. Ms. Anna, please come on stage. Mr. Feby, are you still with us? Yes? Okay. Miss Anna, yeah, time yours.
Halo, Mr. Feby, nice to meet you. Selamat datang. Ini sebenarnya orang Indonesia ya Pak ya, yang berkarya di luar negeri. Selamat datang kembali Pak di Indonesia. Welcome to Institut Ilmu Kesehatan Bhaktiwiyata Kediri. It's an honor for you for join this international seminar technology and health management. I hope this is the beginning our collaboration between IIK Bhaktiwiyata and Griffith University, and I hope together. In the future, we can work in research together, especially Dr. Feby with our lecture in IIK Bhaktiwiyata Kediri. Thank you. I'm very appreciate for your represent in here, and hopefully we can meet in person and later. In a letter. Thank you, Dr. Feby.
So much. Thank you for the opportunity.
Thank you. And this is a certificate for you, and thank you very much for your coming, and I hope for your information we can work together in the future. Thank you, Dr. Feby.
Okay, I would like to, yes, of course, look forward to it, and hopefully maybe you can visit our university maybe in near future. So let you know if there can be any help. So you can visit our university, maybe we can talk about future collaborations. Thank you, Ibu.
Thank you.
All right, let's move on to the third presentation. The third speaker in our seminar today, Dato Dr. Pratapasenan PVC Pillai from Masa University, Malaysia. The title for his presentation will be Health System Support to Prepare for Post-Pandemic Era.
Miss G, excuse me.
All right.
Okay.
The time is
Yes,
yours,
okay.
Miss Yeni.
Sorry for interrupting. With all due respect, Mr. Feby, if you have something considered more important to do on another occasion, well, you may stay here or just leave this Zoom meeting. On behalf of the host and the committee of IIK Bhaktiwiyata, we would like to extend our deepest appreciation to you, Mr. Feby. Thank you very much for your cooperation. We wish to see you again on another occasion. Please give applause for Miss Feby Dwi Rahmadi, PhD from Griffith University. Okay, to warm up this event and create memorable experience for everyone involved, you are requested to take part in this ice-breaking session. And our team, our students will lead you to have fun and relax together. Okay, please come on stage. Please give huge round of applause. We invite all participants here to take part together, take part in this ice-breaking session. Our students, our team will lead you to have fun and relax together. Excuse me, ladies and gentlemen, the participants, you may stand up and follow let's have fun and relax together. This ice-breaking session. Participants who are on me follow the lead of this ice-breaking session. Okay, thank you very much. Oke, masih semangat di sini? Are you? Sorry. Oke, still on fire? Masih semangat ya? Ya, harus semangat ya. Oke. Continuing our agenda today, I would like to invite Ms. Geraldine for our last session. Our last presenter, yeah, please come to the floor to moderate and facilitate the third or the last sharing and occasion.
Yeah, thank you, Ms. Yani. Let's continue the discussion for today. I promise this is the last session, so bear with me, okay? Yeah, the third speaker for today's seminar is Datuk Dr. Pratapa Senan PVC Pillai. He was born on September 13, 1950. And he has been graduate from Master of Public Health, University of Malaya, and Bachelor of Medicine and Surgery, University of Malaya. He has certificate NIOSH Malaysia on occupational health, and presently he is an Assoc Prof in Community Medicine Department, Masa University, Malaysia. Datuk Senan, are you ready? Please, the screen is yours.
Okay. Okay, good morning. It's afternoon here and morning there. Or is it noon in your place? Okay. I would like to thank the institute. The institute called me to present, take part in this seminar today. Your Excellency, Director, the Dean, chairman of the organizing committee, Ms. Dr. February and Rennie, and Mr. Andra. Hi, Geraldine. Nice to have you as a moderator. So I'll go straight to the lecture or talk on health system support to prepare for post-pandemic era. Okay, I'm not very familiar with the Indonesian health system. So my content will be introduction, definitions, more on how this COVID pandemic has affected us and the world, and how the health system has survived or post-pandemic era, as well as some recommendations. The recommendations will be more for what to do in the period, inter-pandemic period. Okay, now introduction. This is the World COVID map as of 22nd of September last year. The case fatality rate at that time, when you calculate the deaths and the number of cases, there were about 314 million cases with 31 million cases and about 970,000 deaths, with a case fatality rate of 3.1%. In Malaysia, we have a population of 32 million, and we have, as of on the 13th of this month, is 5 million cases. This includes repetitions also, those are repeatedly affected. Deaths was about 36 or 37 million, and you have a 0.73% case fatality rate. Now, COVID cases for the world, 680,000 and 680 million, 6 million dead, which is 0.995 case fatality rate. So when you compare the case fatality rate in year 2002 and now, it has reduced now. Overall, it has come down. That means the current variant of COVID is not as virulent as the earliest one. This is normally experienced in any outbreak when there is a jumping of virus from animal to man. First, it brings a lot of death, the first few cases. That's because the virus is not used to the human body as yet, and therefore it kills. And then later on, the virus modifies itself to survive in human beings. And that's why it becomes less virulent and does not have so many deaths. Population, Indonesia has 273 million. You have had about 6.7 million cases, 2.46% of your population being infected, and 2.39% is your case fatality rate. Now, the other theory that I have is virus in the tropical region, we have rain and sunshine. The rain helps to bring down the virus that is in droplets form in the air. That's one advantage for us. And the sun also helps to kill the viruses. So that's why the case fatality rate in tropical region is lower than in temperate climates. See, Malaysia has 0.73, while the world's is 3.1. Now it's come down to 0.99. So this is one of the reasons that is there, that is not medical. That's due to the nature of tropical region and temperate region. Definitions. Coronavirus, a group of virus that causes disease, same as common cold, MERS-CoV and SARS-1 or SARS. COVID-19 is the name given to the present outbreak. It's still going on, but there are a lot of mutations. Self-isolation is the act of remaining in one's home, avoiding contact with other people as much as possible to reduce the spread of the virus if you are exposed. If you are exposed or infected, if you isolate yourself, you can come to a stage when after the disease period, when you become non-infectious, the disease is no more around, okay? Now, social distancing, action taken to mitigate spread of disease, reducing people's contact with each other. Examples include closing schools, encouraging staff to work from home, reducing the number of large-scale public gatherings. Quarantine, this is the most important one in public health. Quarantine of persons is the restriction of activities of or separation of people who are not ill but who may have been exposed an infectious agent or disease with the objective of monitoring their symptoms and ensuring the early detection of case. So quarantine normally is given to a pandemic is a disease normally comes from outside your country. So if you can quarantine all the visitors who have visited the countries where there are disease, and if you can quarantine them properly, the disease can be controlled at the quarantine center itself, and maybe isolation and treatment in a specific hospital which is near the quarantine center. So we can isolate the virus to only certain area in your country. Okay. Now isolation is a separation of ill person or person already infected and from others to prevent the spread of infection and contamination, and also for treatment. Normally viral infections, the treatment doesn't come as fast as identification of the virus. So containment period, steps introduced to prevent virus from spreading for as long as possible, such as detecting early cases, trying to establish who the infected person has been in contact with. So contact tracing must be done very diligently and followed by quarantine. Delay phase, measures introduced to reduce the peak of the virus, slow its spread, such as restriction in public gatherings. These people, the world has gone into what we call as lockdowns, which is actually a very drastic way of controlling any infection spread. Okay, community transmission, when a person contracts the virus, does not having traveled to the affected area and not being in contact with a person known with the disease, we call it so-called community transmission, which means we have failed. Our contact tracing has failed somewhere, so that's why we don't know where this person got this infection from. Pandemic is a worldwide spread of the new disease. So I'll go through fast for COVID-19. I think we have gone through this already. In the early phases of COVID-19, we had 80% recover with mild illness, most likely a common cold, or if possible, some cough, that's all, running nose. 15% moderate disease with pneumonia, but they recover. 5% need ICU care. 1 to 2% of them pass away. From alpha, beta, gamma, delta to Omicron, the virus has changed itself. So we have had actually many epidemics. Epidemic of alpha, followed by beta, followed by followed by gamma, delta, and now we are having Omicron with some others at the same time. So it's actually many epidemics in this pandemic. Okay, symptoms are similar. They have a running nose, cough, sore throat, fever, headaches, muscle pain, and fatigue. Now, factors affecting infectiousness. How does the virus get inside you and survive? Factors affecting infectiousness are the viral load. You need a certain amount of virus to get inside a person for the person to get sick. Aerosol generation processes, distance of the contact, distance of the index patient, how fast for the patient from you, okay, and the duration of contact, how long were you with the person who is infected. Okay, patient susceptibility, this is where age and comorbidity come into place, and transmissibility. The first alpha virus takes a few hours with the contact before you get the disease, but now the Omicron is something like common cold. You can easily transmit from one person to another. The role of public health in a pandemic or epidemic: prevention, health promotion, specific protection, early diagnosis and early treatment, disability limitation, and rehab. So prevention consists of this plus surveillance. Surveillance is looking out for disease as soon as it occurs. So the first disease that comes into a country is God given, but the next that comes from that disease is under man's control. So how fast can we identify the first case that appears in your country is very important. Okay, so that's why surveillance is very, very important in control of a pandemic in your country or an epidemic. So we can reduce the epidemic curve, which I'll point out later. Control, case definition. Okay, when you first have a disease that you don't know what is causing it and what it is, how is it transmitted and all, what we can find out is the clinical features of the disease. So when you have a clinical definition, that's called a case definition. In Malaysia, we've got a book where we have case definition. That means a person who has gone to China, who has gone to the place where there is an infection, who has come into contact with the patient there and comes back, she has got fever and may have fever, which is high fever and all, then it becomes a case definition for the disease. With that, until we get a lab diagnosis ready, we wouldn't be able to diagnose the case. So that's we have to work on case definition and do quarantine for people who fulfill the case definition. Next is contact identification, which is very important with contact tracing. Of course, now they have come up with apps which can help you, but these apps depends on the ability of the person to use the apps, number one, and IT literacy. Quarantine, isolation, follow-up of the discharges, and sanitary barriers, risk management, as mentioned earlier, declaration of epidemic, and the management of regular information sharing. So this is very important. Information sharing, as the previous lecturer clarified, was it must be clear. The best is tell the truth. Okay, so the truth keeps changing because your case definition will change. Once they identify the virus, then they give a name for the disease. So the case definition will change as the disease unfolds. Post-epidemic, post-mortem, and preparation for the future. Okay, this is what we are going to concentrate on. For what will we do to prevent next outbreak, or what changes you need to have in your health system to take care of all this extra workload that drops on you all of a sudden. Okay, breaking the chain. This photo shows this shared by the doctors in Greece. It's the disease that's spreading, and you just remove the person with one of the matchbox down, that matchstick down, you stop the disease there. Otherwise, you'll have the whole thing on fire. Okay, so this is what we call as isolation, quarantine, contact tracing, and all. So that processes can stop the disease from spreading. The other one is if a disease occurs, first is 1 case, 2 cases, 3 cases, then it continues infecting as many people as you can infect, then it will come down as there's no more people to infect. So this is like a fire, forest fire. So when there's a forest fire, normally we will clear the area of trees around the fire so the fire will die down. Similarly here, we go on with early reporting or surveillance, early diagnosis. Then you take rapid response team to go down and check. Then you can reduce the epidemic because of potential case further spread is prevented. Okay, so this is how rapid action can control an epidemic. So these are the cases that can be prevented. This is the disease cases including deaths. So you can prevent disease and death, admission to hospital, and so on. So the priority for public health should be the first consideration when there is an epidemic in any part of the world. Now this is a book that is produced for case definition, that is for infectious disease. So this you will have various diagnoses as the disease progresses. For example, when SARS number 1, first time SARS came into the world, it was controlled and it was eliminated from the world after about 9 months. So any disease that spreads from animal to man, normally that spreads very fast is through respiratory tract, and it can become pandemics. So most of the pandemics that we see is because of respiratory disease spread. So we have to take care of diseases that are spread by droplets and airborne diseases. What is the case definition? Time, place, and person. Clinically compatible case. That's the first one we come up with. That the person has fever, after that he'll get cough, after that he'll have a affection of the lung if you do X-ray and things like that. So suspected case is they'll have fever, they've gone visited a place or had contact with the patient, then you suspect the person, and if he has a clinical presentation, then it becomes a probable case when you can link it epidemiologically with the country or the area where the disease has occurred. Confirmed case is after you get a lab test ready and the lab test says that you have the disease or you're cleared of the disease. So if you're infected, you do the test until you don't have the disease virus test positive anymore. Okay, then you're released back into the community. Now, health system consists of, as mentioned by the previous speaker, is very interesting. Okay, we in Malaysia we have government Western medicine hospitals and health centers, private Western hospitals, which is medicine, which is hospital plus private practitioners, and NGOs, local and international, philanthropists who run the hospitals. Okay, philanthropists will be free service for poor people, traditional medical practitioners whom the people normally go to first before they even go and see a medical doctor. So there are a lot of traditional medical practitioners in Malaysia. We have, according to the races, Chinese, Indian, Malay, as well as the Orang Asli or the Aborigines or the original people who are staying in Malaysia. Okay, related industries that are also in the health system are pharmacies, laboratories, insurance, employers, etc. Now, public health needs in a pandemic. What does the public health need when there's a pandemic? You need quarantine stations first, no? So quarantine stations are always done haphazardly. You know, when you put them all in an open space, what they do is they sit and play or have a drink together instead of being isolated, separated. In infectious disease, you must have them in a room with an attached bathroom. That is how we should do, and food should be supplied to them. Okay, contact tracking and tracing must be done. Contact tracking is tracking of the person who has been found positive, where all did he go. Then you can track where the possible contacts will be. So in Taiwan, they have a system where anytime a person uses his credit card, it can be identified where he was. He uses the identity card to go for traveling in the train, in the bus. So whenever he moves around, they know where actually he went. So that contact tracing, identification and tracing can be done more accurately. And if you isolate them, the chances of propagation of the epidemic can be controlled. Now, screening at ports of entry. These ports of entry, when we talk, we think of only the natural, normal ports like at the borders, either airport, seaport, land port, roads that lead to another country. But we forget that portals of entry in any country, especially Indonesia and Malaysia, we have got a long coastal line. Coastal line, anybody can come in illegally or legally or illegally through these porous regions, and that's how the disease might come. So what we can do is examination of all people who come from infected countries and isolate, and you should quarantine them. Okay, quarantine session must be planned for now itself. Should I tell you what we should do actually? Now, vaccination facilities is another one. That is, if you have a real vaccine. A vaccine is actually that which protects you from getting the infection. If it doesn't protect you, I wouldn't call it a vaccine. Okay. Now, vaccination. Who should be vaccinated? Actually, the people who are on contact, possibility of having the disease should be vaccinated. Mass vaccination is a waste of time and money. And it also involves a lot of money, as well as facilities and staff will be used up for vaccination facilities. We are going to vaccinate the whole population. Because in an infectious disease, the people who are exposed are the ones who are vulnerable, and they should be only be the ones who are vaccinated if there's a vaccine available. Connectivity for information collection, collation, and dissemination, and quality of surveillance system, simplicity, flexibility, portability, stability, acceptability, sensitivity, predictive value of the positive case, and representative and timeliness. So we must have a system that is computerized. That's the best system which can cater for all this. And staff, staff who are trained, and staff welfare should be taken care of. Okay, when the pandemic comes, you must think of who are the people who can get infected. The staff itself need to be quarantined, and we should have replacement. Okay, now post-pandemic era, we might have to deal with long COVID. So we have to follow up those cases that are positive and still have symptoms. So this is one group that has to be followed up, and it seems there are more than, these are the three main symptoms, that is shortness of breath, cognitive dysfunction, people call brain fog, as well as fatigue. So these are the three common long COVID features, but there are 200 more symptoms that you should follow people up, because we don't know how the disease will play out after the acute phase is over. Because some people, they do have chest pain, trouble speaking, some have even described anxiety, depression. So these are all long COVID. So we must plan for long COVID follow-up in the post-pandemic era. And also post-vaccination, or cases of vaccination should also be followed up to see what are the side effects. Now, vaccination should be targeted, a risk-based vaccination, choice of vaccination, vaccines, it must be a real vaccine. Vaccine is for any viral disease so far, is actually you don't get the disease if you are vaccinated. Okay, not in the case of COVID-19, where you have to vaccinate every 6 months. So something is wrong with the vaccine. Okay, now technology involved, cheap, must be accessible, and expiry must be a long expiry date and not short expiry date. Administration of the vaccine, if it's oral or aerosol, which is much better instead of a injection mode and things like that. Storage of the vaccine, all this must be looked into before we actually jump into buying a vaccine or vaccinating people. Okay, post-mortem and past of the past pandemic and epidemic. For any country, we only have epidemics. We don't have a pandemic. Pandemic is only when you talk about the world will say, yes, there's a pandemic. So what a country should do is, how should they take care of their own epidemic? Okay, pandemic is, if there's an epidemic in another country, as one of the lecturers mentioned earlier, it can come to your country within few hours, because everybody can fly. Okay, so we must be prepared. Now, what are the things that you must have is staff matters. We find a lot of them have been overworked. Okay, most of the staff were sleeping. Some of them are dying from the disease and things like that. So these staff matters must be looked into for epidemic cases. When there's a case for epidemic, you must think out of the box and you must do things that are not under the normal purview. Normally, we have a country divided into district, state, and federal. So the district will try to manage on its own until the workers die, then only the state comes in. Whenever there's an epidemic, I think it should be a national matter. Everybody should be involved, and not merely the Ministry of Health. It should be multi-sectoral. All the ministries involved, including police, immigration, customs, any other department that we think of, private practice, everything, okay, should be involved in the control of any epidemic in a country. But the way we work now is Ministry of Health manages first. Okay, so contact tracing is very important. No app will take care of contact tracing. Contact tracing must be done by hardware, not software. You must go there and look for contact, bring them for quarantine, and make sure they are quarantined properly. Okay, management of quarantine cases, mild cases, and home quarantine. Now, mild cases, like for example, the cases of COVID-19, 80% are mild. They need not be admitted at all. See, but because of panic, we admit everybody. The hospital gets overloaded. So what we should have is mild cases should be managed from home and health center. And then from health centers, they can then be the 15%, 20% that need admission can then be referred to hospitals. So this kind of management must come into place and be there. Home quarantine can also be done for mild cases, but quarantine must be done properly in the home, otherwise the family will get infected. Okay, so they should be placed in a room with an attached bathroom. Food should be supplied, and the only thing that I think works in respiratory infection is a mask. Everybody should be wearing a mask when it's necessary. Yeah? Post-discharge case management is important, and staff quarantine must also be talked about. Now, learning from the past experiences and planning for future pandemics and epidemics, event-based surveillance is once you have a case reported, then you have to have rapid detection and rapid control. That means you keep the disease within that area. So you should have local quarantine done for area quarantine as well as individual quarantine. Quarantine can be two types. Quarantine the area of cutting off an area, that is a housing estate or a few houses around the house where the case is, instead of locking down the whole country. Okay, and clusters of disease must be looked for. Rumors of unexplained deaths and cases must be immediately investigated, and report should be done immediately. This is, we have a rapid action team which goes down to the area and carries out this activity. The other one is indicator-based surveillance. It's a surveillance, say for example, we look out for respiratory infection. Whether there's any, this will be reported to you from some of the hospitals and some of the GPs, where you do a sentinel surveillance and laboratory-based surveillance, in where the laboratories report if they identify any cases. So from the laboratory report, you can also know where the cases are. Because in some hospitals, the doctors do not report every case and they suspect, but they do send blood for testing. So when the blood does go to the lab and there's a positive case, the lab also reports to the health office and they take action on that. Okay, so that is indicator-based of surveillance, and response must be immediate. There's no such thing as this a weekend, I'll come on Monday. It should be going immediately, and quarantine all those who are exposed. Now quarantine, those who are quarantined must be separated. You can't keep quarantine people in a place where they can mix around, because in a quarantine there are people who are infected and people who are not infected. The people who are infected in the incubation period will come up with the disease, they'll fall sick. But just before they fall sick, they can still transmit the disease. So we must separate and take quarantine very seriously, then we can control an epidemic in your own country. Yeah? Now, components of surveillance will be systemic data collection framework, how to get the data, the format and all. Then you collect the data. Now it's mainly possible by IT, which is the same time information. You type it in, everybody gets the answer, the result. Okay, they know that there's a case in such a place immediately. So data analysis and interpretation is very important, and this should be given to the timely, that means immediately, to the people who actually take action, which is at the district level. Evaluation of public health actions, whether your action is effective or not effective. Okay, then event-based indicator, event-based surveillance, organized rapid capture of information about events that are potential risk of public health, source of information, ad hoc reports through formal and informal channels, and rumors. Indicator-based, as I mentioned, systemic collection. It can be your annual report, your monthly report, your weekly report, from which you can see a sudden increase in case, you can suspect an outbreak. Okay, follows a predefined format. Data reporting and analysis occurs regularly. Alert and epidemic thresholds used to identify outbreaks. Say, for example, you're monitoring the diarrheal cases in your district health center. Suddenly you see the diarrheal cases go up that week. Then you can expect other diseases to come up in that outbreak. There may be a cholera case which will come out in another 2-3 days incubation period, or in 1 week or 2 weeks if it's a typhoid case, and few weeks if it's a hepatitis A outbreak. Okay, so these are the periods that you can follow by indicator-based surveillance. Data reporting analysis must be done regularly. Alert epidemic thresholds used to identify outbreaks. Now, mandatory notification. In Malaysia, we have this notification of about 32 diseases now, notifiable cases, where every case must be reported. These 9 diseases, now including COVID-19, will be 10 cases are reported within 24 hours. Diseases are cholera, dengue, diphtheria, Ebola, Marburg, food poisoning, plague, poliomyelitis, rabies, and yellow fever. Laboratory-based surveillance is more for as typhoid, paratyphi, salmonella, this is meningitis disease, influenza, and cholera. Okay, so we can look out for this. Sentinel surveillance is for influenza-like illness and severe acute respiratory tract infection, as well as placid paralysis, because we are in the polio eradication program. Now, this is the system surveillance. One is lab-based, laboratory-based, mandatory notification, clinical-based surveillance, community-based surveillance, and other agencies, like veterinary department when there is zoonosis involved. In FOMEMA, this screening of all workers who are expatriates that are from other countries. They come to work in Malaysia, they have to undergo a medical exam. Now, lessons learned, preparedness, capacities and capabilities, rapid response, trained staff. Now, this preparedness is where we are lacking much, because in a pandemic or epidemic of the nature we had, we never think of other people helping you, okay? We always think of Ministry of Health needs budget, Ministry of Health needs this. But we never thought of the private practitioners, we never thought of traditional medicine practitioners and all that. So we also can take into account trainees who can be mobilized to do certain jobs during this period, so that we can relieve the overworked workers in the government side. Rapid response is important, as I showed in the epidemic curve earlier. More rapid, the smaller the outbreak. Okay, trained staff, proper management of livestock industry, early accurate surveillance is crucial. Early identification of pathogen will have resulted in earlier containment of outbreak, case definition, screening, confirmatory tests. So these are important. Every country now, sorry to inform this, but every country should develop their screening and confirmatory test capabilities. Unfortunately, the two big organizations that we depend on, CDC and WHO, has failed us quite badly during this COVID-19 outbreak because of discrepancy which are coming up now. You can see so many people saying that so and so should be put into jail and all that for that, lying to us. So the only way you can take care is each country develop its own lab facilities, as well as, if possible, vaccine production capabilities. Because diseases that can be spread very fast can affect a lot of people in a short time. Multi-sectoral cooperation or collaboration must be made compulsory. Especially if there's an outbreak, I think it's mandatory that everybody in that country helps to control the disease. So that kind of national feeling should be built in every citizen of each country. Conclusion and recommendation: drawing up an action plan. You must have action plan that includes all the players, including citizen, NGOs, academics, private, public, as well as all the ministries that are involved should be there. Because when you want to, say, for example, do quarantine, there will be a lot of people say we lose money, the tourists won't come to our country, So that will be the first reaction. First reaction is always very slow to let the public health do their work. Okay, when public health does not do their work on time, then you have a disaster. Okay, Now, mobilization of health staff, intra-department, interstate, national, interministerial, private, public, as well as others, NGOs, Red Crescent, you have Red Cross, Red Crescent, St. John, all can be pulled into these control measures. Best is don't go to control. If possible, let us prevent before it becomes a control activity. Okay, quarantine facilities. Here we suggest that government should have low cost houses built in various parts of the countries. So when it's in the non-pandemic or epidemic period, these hotels can be used as hotels. But when there is a pandemic, then these hotels should be converted to quarantine centers. Why I say hotels? Because hotel rooms already have attached bathrooms and they are already isolated. Each room is on their own. So you don't have to develop a new or build a new hospital and things like that. So this ability to convert these low-cost hospitals can be a standard procedure for every country that can afford it. Next will be the private hotels, which are too expensive actually. So that's why if it's government-run low-cost hotels with attached bathrooms will be something that's useful, it's economically viable, at the same time is very useful during pandemic or epidemic times. That can rapidly be converted to quarantine centers. Because quarantine centers can also be used as isolation centers for the cases that are not serious. 80% of them are not serious, who can be actually managed at home or managed in so-called hotel isolation centers. Rapid action teams are teams that are trained that can go down to the place where the disease is first occurred, so that it can be contained in that area. Okay. Next is rapid response team. This will be in the federal at the local level. This will be at the federal level where the main team comes down to confirm whether the case is correct or not correct. Okay. Now, field epidemiology training should be given to all public health workers, so they know that how to identify an outbreak and how to identify new diseases. Now, sharing of information, we had a MySejahtera app for contact tracing, but it's more for contact information, it's not contact tracing. So contact tracing is still very, very important, where we should have, first line is the person who is already doing the job. Second line is those people doing the job in other states can be pulled in immediately. Next will be the trainees, and lastly can bring in students, school-going students who can be given a crash course how to do contact tracing. Okay, vaccination only of those exposed and those at risk. At risk means in the area that we have identified the disease. It should not be done for the whole country or so, because that will be not a good economic decision. Manage mild cases conservatively. Do not panic or be panicked. As I see, we are all panicked. Each time they panic you by saying, oh, new virus has come, it has mutated to new virus and all that. When you find that the virus goes through many people, first one person, then it goes to another group, the virus has become used to human beings and it does not kill as much. Okay, so this panic, is it a panic created for economic purposes, or it's actually bad message passed to the people? Okay, decide early to use public health approach. This is very important. If you don't do this, then you'll end up with a lot of disease, controlling a lot of diseases and treating and so on. Building surveillance capacity is the one that you should concentrate on, so that, as I said, the first disease that occurs in your country is God-given. The second, third, and the fourth is man-made, because we have allowed the disease to spread from that person to others who are still in the country. Okay, enhancing global public health surveillance is you have to know which area in the country. It's no point telling the disease is in such and such country. For example, the case of COVID-19, we say it's in the town of It's from one of the cities. But we must know in which part of the city. If the person goes to that part, then he's exposed, not if he goes to the city. We must have that kind of health surveillance available, global. Because now global is mainly, if you have one case of cholera in Malaysia, Malaysia is reported as cholera infested area by WHO. So that kind of thing is not practical now. With the new everybody can travel policies, we must have specific identification. If you can have global geographical mapping of the disease occurrence in any country, it will be very useful in your quarantining of people who come into your country. Now, 14 is prioritize human suffering versus economic consideration, because you don't have the human suffering when the first few cases come in. The economic voice will be louder and drowning the public health work that should be done. Okay, get the involvement of all citizens, maintain the current awareness, build on it, get traditional medical advice and assistance, tell the truth. Okay, tell the truth. What's happening? Tell the truth. Don't hide. Don't try to hide diseases because of economic purposes. Okay, this actually is side effect of lockdown. These are all the containers, oil tankers that couldn't go to any country. And there were many. That time if you had money, you could have bought oil for free, for cheaper amount. And you could have become a millionaire by now. Okay, with that I end the talk. Thank you very much.
Thank you, Dato' Senan. All right. Let's move to the third discussion session. Is there any question from the participant in here? No one? No one? Okay. Let's move along to the question on Zoom chat from Naila Muhammad Gomanars. She asks, what is the challenge that you faced during the surveillance for COVID-19, and is there any difficulty to apply these systems? Dato'? Is there any question from the participants in auditorium? Yes, please come up to the stage.
Challenges is.
Yeah, there is one, Dato'.
Hello, good afternoon, everyone. My name is Alvin Chandra Kusmanama. I'm medical record study of IIK Bhaktiviata Kediri. I would ask a question. The simple question is, COVID-19 in every country now an endemic, and how do we know if a pandemic has turned into an endemic?
What's your name?
Alvin.
Alvin. Thank you, Alvin. Okay, Dato', maybe you can answer them for the first and the second question.
Okay, thank you for unmuting. Okay, challenges, there are many, because challenges, now we are going for all online and by using computer apps and all. But for contact tracing, actually you must be going to see the patient, talk to the patient, find out who are the people who are exposed, and then bring in for contact, for quarantine. We fail because in COVID-19 we have failed in the sense that the activities are limited because the number of staff are limited. Normally public health is not given much importance as clinical. They would prefer to buy the medication to treat them rather than prevent them from getting the disease. Now, surveillance through the other methods of whether it's event-based or this is in an epidemic, as I say, you must have the screening test available. Only then you can know before a person gets sick that that person might be infected. As you know, you get infected, it takes an incubation period, after which you fall sick. So this disease will spread a few days before you fall sick. So we have to catch them. So if you don't have any tests which can identify people, that becomes a challenge. So each country should develop their own test. Like now the vaccine, as far as I'm concerned, I'm not an anti-vaxxer, but I've never heard of a vaccine where you give every 6 months. Huh? Okay, so that is why when we depend on other countries, we may be didorongkan untuk membuat tugas-tugas yang tak benar. Okay, so we have to. Only thing is each country must protect its staff lah. Now we can't depend on WHO or CDC Atlanta, which are influenced by politics and money. Okay. Now the other challenge you may ask, sorry, the question just now was pandemic to endemic. Okay, this is just a definition, my friend. In your country, there's no pandemic. In my country, there's no pandemic. But in the world, there's pandemic. Okay? Pandemic is a definition when the disease is in more than 3 continents. Then you call it a pandemic. But you are experiencing epidemic and endemic disease. Now, SARS-1, there's no endemic now. Why? Is there, when the first SARS outbreak came, all the disease just disappeared, right? Your influenza, Spanish flu disappeared. But in COVID-19, we are having outbreak by different variants. Okay? So is it a new disease, or is it really the change in the virus on its own? We don't know. Okay? So in any disease, in any country, don't allow it to become endemic or become an epidemic. Okay, in this case, we wait for the disease to go away, that's all. You see, like influenza comes and goes. You don't have the same influenza coming to you the next year, right? They call it influenza, but it's a different virus. You need a different vaccine for it, okay? Does that answer your question?
Alfie, is that answer your question? Oh. He said he is little understand. Thank you. All right, all the question has been answered, so that's all for the third discussion today. Dato' Senan, it's nice to finally see you, and thank you for sharing with us. Miss Yeni?
Well, thank you, Miss Gerardine, and thank you, Dr. Pratama Senan, and all the speakers who delivered the material. May all of us get the value and benefits from the presentation. As a form of appreciation, Her Excellency, the Dean of Faculty of Technology and Health Management, IIK Bhaktiwiyata, Ms. Triana Mulyati, would like to give you, Dato' Senan, a certificate as the presenter today.
Hello, Dr. Dato' Pratapa. Nice to meet you. It's an honor for you to join this international seminar of technology and health management. I hope in the future we can work together again, not only in seminar but also in research. I thank you for the presence. Hopefully we can meet in a person later. Thank you, Doctor.
Thank you, Your Excellency. Thank you for the kind words.
Thank you, Doctor. This is a certificate for you, and I hope this is we can work together in a future in research and publication with you and our lecture. Thank you, Doctor.
Thank you, Excellency. Thank you very much. Thanks for the organizers and also Mr. Endra for inviting me. Thank you.
Okay, thank you, Miss Anna. You may back to your seat. And then it's now, it is time for making conclusion. and closing remarks by our moderator. Ms. K, time is yours.
As a moderator for today's seminar, let me conclude all the discussion today. After the outbreak of COVID-19 all around the world, WHO has said there are 6 health systems that can be strengthened, such as service delivery, health workforce, health information systems, access to essential medicine, financing, and leadership. In Indonesia, we can do that by improving to the better condition our primary service, referral service, health security, health financing, health human resources, and health technology. And by doing that, we could learn from Malaysia and Australia for the preparedness, rapid response, train the staff, proper management, early and accurate surveillance, early identification of the pathogen, and multi-sectoral cooperation. Moving right along, I would like to say thank you to all the speakers, participants, and guests today. We look forward to seeing you at the next year's event, 3rd ISOTECMA. It has been my pleasure to be the moderator for today. And thank you. Wish you all the pleasant day. Good afternoon.
Okay, thank you very much, Ms. Gerardine, as our moderator. And of course, we are grateful to our 3 speakers. And Ms. K, please stand by on the stage. We invite the Dean of Faculty of Technology and Health Management, Ms. Triana, to give our moderator a certificate as the moderator today. So this is the certificate for our moderator today, given by our Dean, Ms. Anna Mulyati. Thank you very much, and we hope that all participants could gain much benefit from the topics presented during these sessions. Well, ladies and gentlemen, the upcoming session is door prize awarding. Okay. 3 participants with good and attractive questions will be given door prize from the committee. And more information about this, you may access Instagram at ftmk.bakta and Telegram at t.me/isotechma. Oke, baik. I will switch to Indonesian. Jadi untuk agenda kali ini ada penyerahan door prize bagi 3 peserta dengan pertanyaan terbaik. Ya, dan ketiga peserta dengan pertanyaan terbaik sudah terpilih, dan kemudian untuk informasi lebih lanjut siapa pemenangnya, siapa yang akan mendapat door prize, bisa mengakses Instagram at ftmk.bakta atau Telegram t.me/isotechma yang ada di background. Okay, Excellencies, participants, ladies and gentlemen, we have had a productive time together for the last 3 hours, and this event is about to come to the very end. May we request all participants to fill in the seminar presentation on the link shown on the screen. We provide e-certificate who successfully fill in that form. Please kindly make sure to write down your email correctly so you can simply receive the certificate and the materials presented at this seminar. Could you please show us the link on the screen for seminar presentation today? Okay, make sure you write down your email correctly so you can simply receive the certificate and materials presented at this seminar. Ladies and gentlemen, we now come to the end of this seminar. It is a pleasure to inform you that more than 900 participants brings together to students and lecturers from Indonesia, Malaysia, Australia, South Africa, Morocco, Sudan, Ethiopia, and Timor-Leste joining us on the Zoom meeting and YouTube channel. We really appreciate for the support for sponsorships. This event is fully sponsored by Thomas Song Dental Supply Surabaya and all the parties involved in this event. Without your contribution, this event could not have been a success. Thank you. On behalf of the host and the committee, we would like to extend our deepest for your information that this link for seminar presentation is available only for an hour. Jadi untuk link dari presensi ini hanya tersedia selama 1 jam. Sorry. Jadi linknya bisa diakses sampai dengan pukul 13.10. Jadi 15 menit ya waktunya untuk mengisi linknya. So you have only got 15 minutes to fill in the form on the link shown on the screen. On behalf of the host and the committee, we would like to extend our deepest appreciation to you all. Thank you for your attention and appreciation. We wish you to see you again on another occasion. Stay safe, stay healthy, stay happy, and have a nice day. Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih atas partisipasi dan kerjasamanya. Acara sudah selesai. Mahasiswa boleh meninggalkan auditorium. Ada pesan dari Bu Dekan. Jangan lupa untuk upload foto. Di depan tersedia foto booth. Jadi teman-teman mahasiswa bisa foto di sana dan jangan lupa tag Instagram @ftmk.bakta. Sukses semuanya. Terima kasih. Saya akhiri. Wassalamualaikum warahmatullahi wabarakatuh.